together for this morning review. So every after lecture, I prepared a 40 items quiz, no? So para lang ma-refresh tayo. Sige, so let's start with a very brief introduction. So what is abnormal behavior? Psychological disorder or abnormal behavior. This is a psychological dysfunction within an individual that is associated with distress or impairment in functioning and a response that is not typical or culturally expected. So iisa-isahin natin yung definition. No, number one, psychological disorder is a psychological dysfunction. Number two is a distress or impairment. Number three is an atypical response. So when we say this, psychological dysfunction, this refers to a breakdown in cognitive, emotional, or behavioral functioning. So let's say, for example, if you are out on a date, so definitely, diba, supposedly you're supposed to be fun, but if ever you feel fearful, because you do not, let's say, for example, trust the man, so can we consider you not normal? So hindi, no, kasi nga merong physical dysfunction kasi all of a sudden, after having this conversation with your date, parang hindi ka na comfortable. So ang sinasabi dito yung psychological dysfunction, it's not, it's a weak criterion. So we can still consider you normal, no? So another example, yung phobia, no? So pagka ang tao may phobia, they feel anxious and fearful, especially if the feared object is present, no? Let's say, for example, may takot sa snake, no? Pero a person without phobia, no, pwede din naman kasing matakot sa snake. So can we consider you not normal, no, just because you are fearful of snake? So definitely hindi pa din siya. So this is the very reason why having a dysfunction is not enough to meet the criteria for physical dysfunction. Another one is personal distress or impairment. So let's say, for example, if someone close to you dies, definitely you'll be upset. So you are now experiencing personal distress, but can we consider you a person with psychological disorder? So hindi pa din siya. So because it's a normal reaction, parang nag-COVID cases tayo nung COVID pandemic, nung una-una, talagang everybody were in distress, kaya na-impair yung ating functioning. Pero we cannot consider ourselves not normal. Another example din dito is when you're feeling shy or lazy. For some days, diba, you do not feel like working or studying, or bigla in one social functions, inabot ka ng hiya, so can we consider you not normal? So hindi pa din naman. So although this criterion, yung personal distress or impairment, it's actually a very good criterion because the person gets to report it. Kaya lang, mayroon pa din siyang disadvantage kasi paano kung may problema na pero hindi pa din nire-report ng tao. So if we are to consider personal distress or impairment a criterion of psychological disorder, so paano nga yung mga tao na may psych disorder such as mania? So a person with manic episode does not experience personal distress or impairment. So very excited yan, they sleepless, they're very much energized, agitated, pero para sa kanila, walang problema yon. So pag tayo nakikita natin ang behavior nila na ganon, something is wrong. Kaya lang, if we are to consider this criterion, hindi nila ire-report talaga kasi feeling nila walang problema. So another one, yung atypical or not culturally expected. This has something to do with norm violation. So pag sinabi nating atypical, kakaiba, we deviate from the average. Let's say, for example, a grade 3 student, meron tayong kasi minsan kino-consider na average height, pero if one student is very tall, grade 3 pa lang pero sobrang tangkad na, so atypical siya, hindi hindi siya yung norms. So we cannot of course consider this child not normal. So another view is that your behavior is let's say yung behavior mo na atypical, usually this alienates the non-conformist, just because let's say you do not follow what is expected by the society, kino-consider ba natin itong not normal? So hindi rin talaga. So another example dito yung the roles of men and women, yung mga may gender bias, so hindi siya pwedeng i-consider na not normal. So in conclusion, it is difficult to define normal and abnormal, no, because there are too many factors to consider. So in relation to atypical or not culturally expected, no, may tinatawag tayong cultural relativism. This is the perspective that holds that there are no universal standards or rules for labeling a behavior as abnormal. So instead, no, behavior can only be abnormal relative to cultural norms. Kaya lang dito, ang sinasabi kasi ng cultural relativism, pwede natin mo-consider ang isang behavior as abnormal kung depende sa practice ng isang society. However, opponents of cultural relativism argue that there is a danger when societal norms are allowed to dictate what is normal and not normal. So example here, we have Hitler. No, actually, Hitler branded the Jews as abnormal and used this as one justification for the Holocaust. Another one, yung Soviet Union. No, this is a communist country, and they consider people who were against the government as mentally ill and jailed them in mental hospitals. So another example then, if you remember the history, di ba yung sa Amerika, ginawa nilang slaves yung mga Negroes. So they labeled them, no? Let's say for example, may gumawa pa sila ng diagnosis na drapetomania. No, this is a sickness that caused them to desire freedom. At saka yung dysphagia, the Ethiopies, no, refusal to work for one's master. So ito yung nakikita natin sa film, no, na kapag ayaw nilang magtrabaho, pinaparusahan sila. No, pero ang kanilang rationale for this, kasi something is wrong inside the body, no, following the theory of Hippocrates, na if someone is not behaving properly, no, something is wrong inside the body, kaya nila latigo para daw yung blood circulation mag-function ulit. No, binibilid sila sa ilalim ng araw para magising sila, no, kaya they starve these people, no, para mag-function normally yung kanilang internal organs. Pero ito lang, no, this is the consequences, no, when we allow the society to dictate what is normal and not normal. So what is the accepted definition? So I believe we have to accept the definition given by the DSM-5. It describes behavioral, psychological, or biological dysfunctions that are unexpected in their cultural context and associated with present distress and impairment in functioning, or increased risk of suffering, death, pain, or impairment. So it's a combined standard now. No? It's based on facts. No? Of course, when we say facts, this is based on statistics, talagang nag-conduct ng research, and then based on values, no? Based on adaptation or adherence to norms. And these are the 4 categories that we need to consider before we diagnose a person with such disorders. No, number 1, behavior that is harmful to the self or that is harmful to others. No, letter B, the poor reality contacts. Letter C, emotional reactions inappropriate to person situation. And letter D is the erratic behavior na that shifts unpredictably. Dito sa letter B, yung poor reality contacts, we have hallucinations, no, delusions. No? So what is the difference between hallucination and illusion? No, pagka-illusion kasi, merong presence ng object, no, pero nagkamali lang ng tingin. Pero pag sinabing hallucination, walang presence ng object pero may nakikita o kaya may naririnig. So yung illusion and delusion, illusion and hallucination, ang problem nito sa senses. No, pero yung delusion, ang problem naman nito sa thought content. Now when we say delusion naman, this is the false belief. No, meron sila mga delusions of grandeur, no, delusions of persecution. So papasok yan dito sa poor reality contacts. So even if there's a definition given by DSM-5, most of the theories, no, mga researchers and even psychologists and even psychiatrists would agree na mahirap pa ding mag-diagnose ng psychological disorder. Pero how to do it, no, the best way is still to consider how the apparent disease or disorder matches a typical profile of a disorder. So when we say typical profile, ito na yung nakikita natin sa DSM-5. No? Yung diagnostic criteria, let's say for example, for generalized anxiety disorder, so titingnan natin tong criteria kung na-meet yan ng client or ng patient. So most likely we can diagnose him with such disorder. So the science of pathology, when we say psychopathology, science of psychopathology, this is the scientific study of psychological disorders, usually conducted by the following mental health professionals. Now we have the clinical and counseling psychology, psychiatrists, psychiatric social workers, psychiatric nurses, marriage and family therapists, and mental health counselors. So very fast, no, review lang ito. When we say psychiatrists, these are the physicians No, they prescribe medication, treat physical ailments, and give physical examinations. Their medical training makes them potentially better able to recognize medical problems that may be contributing to the patient's psychological distress. So ang mga psychiatrists pwede din naman mag-counsel. They can also conduct psychotherapy unless they are trained. Pero ang pinaka number one task nila is to prescribe medication. Clinical psychologists, so our activities involve therapy, assessment, teaching, counseling, research, and consultation, plans and implements programs for behavior modification, and selects, administers, and interprets psych tests. Psychiatric social worker, ito deals with social forces and external agents that were contributing to the patient's difficulties. So ang mga social worker talaga ang nasa labas, sila yung nasa field. No, they take case history, interview relatives, and make arrangements for vocational placement. They can also perform counseling and psychotherapy, no? Kasi alam ko kasama yan sa curriculum din nila. Psychiatric nurse provides information about clients' hospital adjustment patterns, play a crucial and sensitive role in fostering an appropriate therapeutic environment, and responsible for the nursing care of mental health clients. Marriage and family therapies provide psychotherapy, usually focusing on couples or families. Paraprofessionals, these are people who are trained to assist professional mental health workers. We have community mental health workers. Usually they do crisis intervention. The drug abuse or alcohol counselor, management and evaluation of addicts. Pastoral counselor, ministerial background and training in psychology, and chaplain internship with mental health facility. So yung mga paraprofessionals, usually they attend mga short courses, seminars, workshop, so they can assist professional mental health workers. Hello, can you see the PowerPoint?
Yes.
Ay, okay, thank you. Hindi ko siya maano. Okay, so let's review the history of abnormal behavior or abnormal psychology. So these are the models to follow or to take into consideration for us to understand the history and the conceptions of abnormal behavior. So number one, the supernatural model. Number two, the biological model. Number three, the psychological model. So as we all know, sa supernatural model, during the ancient times, if a person manifests deviant behavior, this is considered as a possession. So how do they do the diagnosis? If one speech has a mystical significance, it is considered good devil. If an individual was excited or overactive, it is considered a bad devil. So there were two accepted treatments during that time. Number one is the trephining and number two is the exorcism. Now, when we say trephining, this is boring a hole through the skull. Now, what is the rationale for doing this? Para daw mawala yung devil. No, pag namatay nga ang belief nila noon, pag namatay yung pasyente, nawala na yung devil sa body niya. No? Pero technically talagang mamamatay si patient. Kasi if we are to imagine boring a hole through the skull, will definitely lead the person to death. Tapos yung exorcism, I believe we still practice this nowadays, pero it depends on the culture and belief of a person. No, this is coaxing the bad spirit out of the victim's body. No, pero ang pag-exercise noong unang panahon, depende din sa kanilang diagnosis. Kasi if the person is very quiet lang, hindi siya masyadong nagwawala, usually they are offered prayers lang, incantation. Pero pag nagwawala yan or agitated siya, ito yung ginagawa nila na nilulublob sa malamig na tubig, no, tapos nilalatigo din yung pasyente, no, para daw lumabas din yung devil. So I believe in the Philippines we also do this, no. I think merong mga licensed priests to do this, no, pero meron din silang team ng mga psychologists and even lawyers, no, para ma-rule out nila kung talagang ano siya, possession siya. And then we have mass hysteria. No, this is the number one, no, psychological disorder, no, during the ancient time, very common among females. So pagka sinabing mass hysteria, ito yung talagang hysterical, no, pero noon ang akala nila yung pagwawala nila parang sumasayaw lang. Kaya ang mass hysteria is also known as the Saint Vitus dance o kaya yung tarantism. So what they do during the ancient time, pagka may mga hysterical, no, they play musical instruments, no, then they lead the people or these women sa Saint Vitus Hospital, no, kaya tinawag siyang Saint Vitus dance. Pero nowadays this is known as emotional contagion. No, this is the experience of an emotion that seems to spread to those around us, also known as the mob psychology, no, known as the shared response. Now, we have cases in the Philippines, so this is one example. No, in Don Vicente Rama National High School in Basac Pardo in Cebu City, no, 21 students caused a commotion with their strange behavior, no, crying, jugs, screams, fainting, and uncontrolled body movements. Parents suspected they were possessed by spirits. Some of the girls were brought to the barangay hall, where they were made to lie down quietly in cots to rest. So iniisip nila, is this a case of possession or baka naman they were just carried away by scary stories, no, during a weekend camping trip. Then we have Paracelsus, the full moon, no, nag-iiba daw ang behavior ng tao kapag kabilugan ng buwan. So lunatic, no, yung tawag diyan. Si Paracelsus ang nag-theorize. And then we have lycanthropy, also known as werewolfism. Also has something to do with the full moon, no, nagbabago ang behavior. Pero literally hindi naman talaga siya nagiging werewolf, no. So the person mimics the behavior of the werewolf. And then the witchcraft. Ang witchcraft based on other textbook has nothing to do with the history of abnormal psychology. Kaya lang ini-include siya kasi noong unang panahon, in some way, this is a violation of the social norms kasi ang mga witches noong unang panahon, mga females ito na against the government. So they were labeled as witches, no? So yung iniisip natin na witches na nangkukulam, hindi siya noon ganon. Ano sila, mga female who are very assertive of their rights. Kaya lang, since the society at that time was allowed to label what is normal and not normal, so they were labeled as not normal. Either they are kinukulong sa mental asylum, no, beheaded sila, o kaya yung sinusunog sila ng buhay, no? So yan. So during that time, meron pa silang mga identified people, no, trained people to identify witches. And then came the biological model. So we have Hippocrates and Galen. Nung dumating sina Hippocrates and Galen, medyo nawala na yung mga beliefs about lycanthropy, no, yung mga possessions, no, so medyo naging scientific na siya. So Hippocrates proposed Hippocratic corpus, no. He suggested that psychological disorders could be treated like any other disease, no. And this, it can also be caused by brain pathology or head trauma and can be hereditary. So he also theorized the humoral theory, no. So blood, ang affected dito is the heart, the black bile, the spleen, the yellow bile is the liver, and the phlegm is the brain. So diseases resulted from too much or little of one of the humors. So example, too much black bile, no, can cause melancholia, or now known as the depression. What is the implication of Hippocrates' theory? No, this associated psychological disorders with a chemical imbalance. Na totoo din naman, di ba? So we now believe na in some way, let's say lesser secretion of serotonin can cause depression, no? So pwede din siya. And then bleeding was introduced by Galen. Now, this is a carefully measured amount of blood that was removed from the body. So he showed that the arteries contain blood and not air as commonly thought. Bleeding is still practiced nowadays, so this is now known as the bloodletting. No, kasi tama din naman, no, kapag let's say nag-donate ka ng blood, talagang our body will replenish new sets of blood. No, kaya healthy ang nagdo-donate ng blood. And then we have Plato. No, according to him, mentally ill should not be held accountable or punished, and care for mentally ill should be family responsibility. Asclepiades, he differentiated acute and chronic. Now, what is the difference between acute and chronic? Pag sinabing acute, suddenly. No, pag sinabing chronic, matagal. No, so describe the characteristics that distinguish hallucinations, delusions, and illusion, and explain how these characteristics could be used as diagnostic signs. During the 19th century, they were able to identify general paresis or dementia paralytica, a mysterious syndrome of involving the gradual and irreversible breakdown of physical and mental functioning. This is now known as a syphilis, no, a sexually transmitted disease caused by syphilitic microorganisms. So nung na-discover nila itong general paresis, doon nila nalaman na may mga physical diseases pala that mimics the signs and symptoms of psychological disorder. And this is also the very reason why we need to collaborate with psychiatrists or medical doctors, kasi may mga physical diseases na akala natin ay psych disorder pero hindi naman pala. No? So another example na I can give let's say hypothyroidism. No, one of the symptoms of hypothyroidism is depression. No, so akala natin depressed siya kung wala tayong idea na meron siyang hypothyroidism. Counsel tayo ng counsel o kaya we give psychotherapy pero no improvement at all. So yung pala ang kailangan niya medical doctor. So medication yan. And then John P. Gray, no, so according to John P. Gray, the cause of insanity is always physical. And he was the one who invented the rotary fan. Ano to, class? Yung parang exhaust fan. And because of this, talagang yung rate ng improvements sa behavior ng patients at saka yung kanilang rate of recovery talagang tumaas siya. Kaya lang ang negative na nangyari dito dahil nga marami yung gumagaling, napuno yung kanyang mental hospital ng mga pasyente. And this was the reason also that's why they did the institutionalization. No, ito yung mga patients were released into their communities. So ang ginawa dito talagang nilipat yung mga pasyente, no? Parang halimbawa dito sa Manila, kung taga Bataan itong isang pasyente, ililipat siya doon, no, para hindi masyadong mapuno. So yung developments of biological treatments, so yung electric shock, no, brain surgery, even drugs, no, actually yung drugs, the discovery of drugs was by accident. So yung insulin was occasionally given to stimulate appetite in psychotic patients who were not eating, but it also seemed to calm them down. Then they also introduced the insulin shock therapy, pero hindi na ito ginagawa ngayon. No, and then Benjamin Franklin discovered accidentally and then confirmed experimentally in the 1750s that a mild and modest electric shock to the head produced a brief convulsion and memory loss or amnesia, but otherwise did little harm. So in some way, no, Benjamin Franklin is also included in our history. No, kaya dito rin na buo yung ECT, yung electroconvulsive therapy. Effective drugs for severe psychotic disorders were developed in a systematic way. No, yung opium, it was used as sedatives. The reserpine and neuroleptics, or the major tranquilizers, the first-time hallucinatory and delusional thought processes could be diminished in some patients to control agitation and aggressiveness. And benzodiazepine, no, the minor tranquilizers reduce anxiety. Anyway, nice to know lang ito. I believe that's not included. No, yung psychological model naman, no, we have Felipe Pinel. So Felipe Pinel was the one who championed, no, the release of patients from jails and chains. No, so nung ginawa nila ito, tumaas din yung rates ng recovery and improvements on the part of the patients. So they proposed the moral therapy. Now this aimed at treating mental patients like human beings, and 70% of those hospitalized either improved or recovered. So systematically introduced by Felipe Pinel and his close associate John Baptiste Poussin. So pag sinabing moral therapy, ito yung bringing back their moral, no? It will improve their self-esteem, no, self-confidence. Ito yung bibigyan ng task ang patients. Then every after accomplishing the task, no, they will give positive feedback. O kaya ito din yung counseling o kaya mga recreational activities. And then after him, sumunod naman si Took, William Took. Yung sa kanya naman is the York Retreat. No, sa kanya, ang belief niya dapat dalhin sa probinsya ang mga pasyente dahil nga contributory factor din ang fresh air, no, yung less noise, na tama din, no? Because when they did this at the time, talagang tumaas din ang recovery rate and improvements, no, on the part of the patients. Then we have Benjamin Rush. No, sa kanya, ang ginagawa pa din niya at that time yung bleeding, no, and then yung ice cold baths, tranquilizers, and he was the one who advocated for hiring kind and intelligent attendants, no, kasi nga kailangan dahil iba ang needed na understanding ng mga pasyente. This is his tranquilizer, no, so hindi siya medication pero para siyang electric chair, no, pero tinatali lang diyan yung pasyente para mag-pacify siya, and then kino-cover yung eyes para hindi masyadong distracted sa mga stimulus. And then we have Dorothea Dix, no? She was responsible for funding and founding of mental institutions, and she also organized the mental hygiene movement. I believe kasama din niya dito noon si Clifford Beers. No? Do you know Clifford Beers? No? Siya yung author ng a book entitled A Mind That Found Itself. No? He was actually diagnosed with hypochondriasis, or now known as illness, anxiety disorder. Kasi yung kapatid niya ay namatay dahil sa epilepsy. So all his life, iniisip niya lagi na baka ganun din siya. No, so he tried to commit suicide, no, pero luckily hindi siya namatay. And that was the time na dinala siya ng parents niya sa mental asylum. Pero dahil in contact with reality si Clifford Beers, doon niya nakita kung paano i-treat ang mga pasyente. And then he made a letter, no, or he wrote a letter to the government na naipuslit. So that was the start of the reform. No? So ito yung dating ng mental hygiene movement. Kaya lang may disadvantages itong nagawa ni Dorothea Dix. Dumami ang mental hospitals, kaya lang they were not able to hire kind and intelligent attendants. So medyo nagkagulo na, no, naging na siya, custodial care na lang instead of the moral therapy. No, when we say custodial care, no, pakainin, paliguan, no, patulugin lang ang patients, then after that wala na. No, kaya medyo bumalik na nun ang biological. So this is again the development of the biological viewpoint and the decline of the moral therapy. So when we say development of the biological viewpoint, no, naniwala pa din ang mga tao na at that time na kailangan ay medications, no. So wala masyadong counseling, no, wala na masyadong psychotherapy. And then of course the study of abnormal behavior no flourished across America and Europe. So maraming panahon ang lumipas hanggang sa dumating si Wilhelm Wundt, no, considered as the father of experimental psychology. And then we have Emil Kraepelin. So Emil Kraepelin furnished psychiatry with a classification system based on medical model. So paano niya ginawa yun? Ginaya niya yung sa medicine. No, example, what are the signs and symptoms of tuberculosis? No, nakalista yan. What are the signs and symptoms of cancer? Let's say cancer of the skin, no, nakalista din yan. So ginaya niya yun sa psychological disorder. Now, what are the signs and symptoms of schizophrenia? What are the signs and symptoms of depression? So naka-classify na siya, no, that we now enjoy. No, so kung wala siguro si Emil Kraepelin, no, baka hanggang ngayon nalilito tayo. And then we have Franz Anton Mesmer, considered as the father of hypnosis, also known as mesmerism. No, so hypnosis or mesmerism is an artificially induced trance in which the subject becomes highly susceptible to suggestion. Ito yung naging practice ni Mesmer kasi according to him, gumagaling ang pasyente niya. No, ito yung power of suggestion eh. No, kaya lang very traditional at that time. He was questioned, no, bakit ganyan yung treatment mo? So dapat balik ka sa dati. Hanggang sa he was disbarred, no, from the practice, and then nung sumama ang loob niya, no, he died. Kaya lang hindi niya alam, no, may mga medical doctors who followed his footsteps, no, about hypnosis. So we have John Martin Charcot, no, he conducted researches, no, and then presented to the body the benefits of hypnosis. And then Sigmund Freud actually heard about John Martin Charcot and then studied under his supervision. So nung natapos yung training niya, no, Sigmund Freud went back to Vienna and then worked with Joseph Brewer, who at that time was working with the case of Anna O. And then silang dalawa na yung nag-work. No? Yan na yung start ng psychoanalysis. No? Kaya lang si Joseph Brewer and Sigmund Freud did not their collaboration did not last, no, kasi Joseph Breuer did not accept Sigmund Freud's theory, particularly the libidinal energy, okay, yung kanyang Electra at saka Oedipus complex. And then Sigmund Freud also believed that not everybody can be hypnotized. Kaya he came up with his own therapy known as the psychoanalysis. No? So higa ka lang dyan sa couch and then you talk about your problems and then we'll discuss about it. So yan na yung start ng psychoanalysis. So nung dumating na si Sigmund Freud, ito na yung kinonsider na ang mga psychological disorders can be caused by repressed emotions, no, mga past memories, no, mga hidden thoughts, no. So yan na yon. We move on to the different psychotherapies. Different theories. Okay, so we start with psychodynamic perspective. So these are the different psychosocial theories. Number one is a psychoanalytic theory, no, of course, proposed by Sigmund Freud, concerned with the dynamics or interaction of forces lying deep within the mind. So this is the first systematic step in understanding psychological factors, no, in mental disorders. Kasi nung bago dumating si Sigmund Freud, it's more on science, no. So na ano siya, na enlightened sa physical diseases, no? Kay Hippocrates nag-start nga yung hysteria na this is caused by a wandering uterus, no? Pagka iba ang behavior noong unang panahon, this is oftentimes believed na may problema sa internal organs, no, o kaya sa physical body, no? Pero nung dumating na si Sigmund Freud, ito na yung naintindihan na yung psychological factors can be one factor, no, for mental disorders. So as we all know, according to Sigmund Freud, no, our personality is composed of id, ego, and superego. So id follows the pleasure, no, the ego follows the reality, and the superego follows the moral principle. Pag nag-aaway, nagtatalo yung tatlo na ito, no, this is known as the intrapsychic conflict. No, pagka, let's say, the id is too dominant, the superego is too dominant, nahihirapan si ego. So I'm sure you also experienced this, di ba? So ang tinatawag natin dyan is the intrapsychic conflict. Pagka nahihirapan si ego, our ego will resort to the use of defense mechanism. So this is a method or methods of attempting to protect the self and cope with basic drives or emotionally painful thoughts, no, feelings, or events. What are the purposes of the ego defense mechanisms? This is to increase anxiety, no, to protect the ego, no, to increase the self-esteem. What are the characteristics of defense mechanisms? The use is automatic. Now, this is not pathological unless overused to a degree that they can reality. No, primarily unconscious behaviors, however, some are with involuntary control. So we review what are these defense mechanisms. Number one, compensation, covering up a weakness by emphasizing desirable traits. And there are two types, yung direct compensation tsaka yung indirect compensation. When we say direct compensation, you focus on your weakness. No, kung halimbawang hindi magaling sa sports, talagang you attend sports clinic, you practice playing basketball. When we say indirect compensation, you focus on your strength. Let's say you're not very good in sports pero very good naman sa academics. No, yung indirect compensation, another example dito, if ang parents natin halimbawa frustrated doctor, no, so pagka after passing the board exam, anak, ikaw naman ay mag-take ng medicine. So in some way, no, na fulfill yung kanilang weakness through you. No, that's one example, indirect compensation. Conversion, when we say conversion, this always has something to do with physical symptom. No, so ito yung keyword niyan. Usually sensory motor in nature. No, yung hindi makakita, no, biglang makalakad, you are assigned to sing in front of a large audience, no, biglang nawalan ka ng boses, may conversion. Kaya lang after that stressful event, you will be surprised, okay ka na. No, kasi nga in some way you were able to protect your ego. No, pagka kinwestiyon ka, sayang naman yung opportunity, hindi ka nakakanta. Nawalan nga ako ng boses, di ba? So yan na. So we were able to defend, no, ourselves. Number 3, denial. Refusal to face reality. Oftentimes the first step, that whenever the first thing that we do, no, every time we receive bad news, no, pero after some time, pag nahimasmasa na, we get to accept the reality. Number 4 is displacement. Now, when we say displacement, we channel our energies toward less anxiety-provoking stimuli or less threatening object or person. So yung hindi makakalaban sa atin. No, so sinipa mo yung chair, inaway mo yung mas bata mong kapatid, no, yun ang tinatawag nating displacement. Dissociation is dealing with emotional conflict by a temporary alteration in consciousness or identity. Experienced by people with sudden trauma o kaya accident, pwede, nag-dissociate. Actually, we experience this. No, I'm not sure kung na-experience nyo minsan pagka under stress kayo or inaantok todo o kaya maraming iniisip, you tend to dissociate. No, hindi mo alam yung hinahanap mong salamin nasa ulo mo pala or nasa yung pencil mo nasa tenga mo pala o kaya you do not have any memory paano ka napunta sa library, no, yung pala dahil marami kang iniisip, dissociation, pero bumabalik man tayo sa reality. No, and then identification, increasing feelings of self-worth by identifying with a person or organization. No, let's say for example, you're not very good in math pero ang barkada mo mga yung math club members. Okay, you're not very good in sports pero ang barkada mo yung mga athletes in your campus. No, that's an identification. 7, intellectualization, separation of the emotions of a painful event or situation from the facts involved. No, acknowledging the facts but not emotions. So pag sinabi intellectualization, kinikwento ka ng, let's say, kinikwento mo yung mga nangyari na hindi maganda, no, pero there's no involvement of emotions. Number 8, rationalization, excusing own behavior to avoid guilt, responsibility, conflict, anxiety, or loss of self-respect. Now, there are 2 types of rationalization. We have the sweet lemon tsaka sour grapes. Ang sweet lemon, we look at the benefits, no? Nire-rationalize natin. Let's say, for example, okay lang na namatay na siya, no? At least hindi na siya nahihirapan. No? So, okay lang na nag-stop muna siya sa studies, no, at least ngayon, no, yan, nakapag-ipon siya and then tuloy-tuloy na siya sa kanyang education. Sweet lemon 'yon. Pag sour grapes, medyo bitter yan, no. Let's say for example, na busted, no, ng kanyang nililigawan and then ang kanyang rationalization hindi ko naman talaga siya type, no. Ayan, so practice lang ako. Ayan, so that is sour graping. O kaya kaya ako nag-fail kasi si teacher malabo magbigay ng instructions. So yeah, that's also sour graping. Number 9 is projection, no, externalizing blame to others. No, so yung ating weaknesses o kaya shortcomings sa ibang tao natin siya nakikita. So actually ang projection is very dangerous kasi if a person lacks self-awareness, talagang lagi na lang sa iba ang bato. No, so hindi nakikita yung kanyang personal shortcomings and weaknesses. Number 10, introjection, no, incorporating external values and standards into one's own ego structure. Ito yung pag sinabi natin introjection, you incorporate naman, the opposite of projection. No, pag sinabi kasing projection, you externalize. Pag sinabing introjection, you incorporate. Oftentimes used by a person with depression, no, laging akong may kasalanan. So lagi ini-incorporate. O kaya pwede ding another example dito, let's say wala ang parents, no, yung panganay na anak, ini-incorporate niya yung values and standards ng parents. Kaya ganun siya mag-alaga sa bata niyang kapatid. Ang introjection is also very dangerous kasi kapag nasobrahan sa introjection, you tend to lose yourself. no? Kasi you tend to patronize other people, no? Kasi ini-introject mo yung values nila, no? So talagang you really, ano ba tawag dito, para sa'yo, model siya talaga. Pero pag tinanong mo bakit, wala naman silang masagot. No? They cannot provide a logical explanation. Bakit ba talagang they value the other person's values? No? Nahihirapan silang mag-ano niyan, i-separate. So nawala na yung kanilang self-identity because they patronize other people already. Nag-introject na sila. 11, reaction formation is the opposite of the truth. Yung kabaligtaran, let's say, tinutokso mo siya sa kanya, pero ikaw pala ang may gusto sa kanya, no? That's reaction formation. Regression, regress, no? You revert to a previous developmental stage. Example, adult throwing temper tantrums. Let's say you invite your friends to play patintero, no? Yan, mga regression yan. And then 13 is repression, no? Preventing painful thoughts from being conscious. So ito yung favorite ni Sigmund Freud, na yung repression. Ito talagang unconscious siya. No? So hindi natin namamalayan, talagang nadadala natin yung ating bad memories sa unconscious level of awareness. Ang suppression is the opposite. This is conscious. No, consciously postponing attention to a conscious impulse or conflict. No, let's say for example, may problema sa bahay. So, pagdating sa school, hindi ko muna iisipin kasi I need to concentrate on my studies. Suppression yon kasi aware ka. No? O kaya, ano pa ba? Pwedeng after taking the board exam, o magmo-mall-mall ka muna, no? Malling, o kaya you join your friends for a vacation, no? Para hindi mo muna maisip yung result, suppression yon kasi aware ka. No? Yung repression, unconscious siya. Sublimation, diversion of consciously unacceptable instinctual drives into personally and socially accepted areas. So ito yung sublimation, nag-sublime ka to what is accepted by the society. This is actually considered as the best defense mechanism kasi you get to adapt, no? Flexible ka sa needs ng ibang tao. Kung halimbawa you really want to smoke, no, inside the room pero hindi talaga po pwede, no, so you will just simply chew bubble gum o kaya eat candy, no, that is sublimation. Another example dito, let's say a sexual pervert, no, so instead of doing the act, nag-ano na lang siya, nag-sublime siya sa art, no, ayan, so nag-painting na lang siya o kaya nag-attend siya ng art school, no, that is sublimation. Substitution, replacing the desired gratification with one that is more readily available. So nag-substitute mo, no, let's say hindi pwedeng mag-apply sa Amerika o open naman ang Canada, doon na lang muna ako, no, nag-substitute. Ayan. And then 17, undoing. A person tries to undo an unhealthy, destructive, or otherwise threatening thought or action by engaging in contrary behavior. So ito, wag ka nang magulat kapag let's say yung partner mo without any occasion, meron siyang flowers sa'yo or chocolate. No, yan, nag-undo. So pwedeng merong ginawang hindi maganda. No, possible. O kaya, all of a sudden, nilibre mo yung kapatid mo ng pagkain, no? Kasi you want to undo na pagalitan mo siya kasi before. And then splitting, a person is viewed as neither good nor bad. Ano to, yung splitting, oftentimes used by a person with borderline PD. They see, pagka mabait ka sa kanila, they still see you as bad person. Pero pag bad ka naman, they see you as good person. So nakakalito. No, that is splitting. So these are the different defense mechanisms commonly used in each respective disorder. So I believe you need to memorize this. Baka kasi matanong siya. No, ang paranoid, they make use of projection. Ang depression, oftentimes introjection. Ang phobic disorder is displacement. Bipolar, reaction formation. Amnesia, dissociation. Ang substance abuse is denial. Obsessive-compulsive disorder ito. Obsessive-compulsive disorder is undoing. Borderline is splitting. Catatonic is repression. Anorexia nervosa is suppression. Schizophrenia is regression. So yeah, so di ba nabanggit kanina, one of the characteristics of defense mechanisms, it's not pathological unless overused. So how will we be able to identify kung hindi natin yan na-overuse kapag you still accept responsibilities, no? Yan, yung you do not blame other people all the time. From time to time, inaako mo pa din. So that's also one indication na mentally healthy ka. So again, then we have 3 levels of awareness. So we have the conscious, the pre-conscious, and the unconscious. So when we say conscious, this is, let's say, if you're conscious of what we're doing right now, ito yung talagang ginagawa natin at the moment. Yung pre-conscious, ito yung mga nasa ano natin, yung memories that can be retrieved, no? So anong ginawa mo kahapon, no? Anong ginawa mo last year, no? Naaalala pa natin 'yan. Yung unconscious level of awareness, no, this was discovered actually by Freud when Anna O cannot remember anything, no, after her hypnotic stance. So ito yung pinaka-favorite ni Sigmund Freud kasi lahat daw ng ating hidden desires, no, mga evil desires, embarrassing moments, mga traumas nasa unconscious level of awareness, and that causes our deviant behavior. No? So, pag nakita daw yan, no, most likely, no, we will be okay. So what are the techniques of Sigmund Freud? No, we have free association. So when we say free association, you just simply lie down and then you talk about your problems. And then we have dream analysis, and then yung slip of the tongue. So, and then of course, transference. This is practiced by Sigmund Freud. Now, when we say transference, the patients come to relate to the therapies much as they did to important figures in their childhood, particularly their parents. So, bakit ba, let's say, favorite ka ng client mo o kaya pwede ring ayaw niya sa'yo, pwede kasing nare-relate niya sa'yo yung kanyang significant others. Ang counter-transference naman is the opposite. So the therapists now project, no, some of their personal issues and feelings, usually positive naman, no, into the patient. No, bakit ikaw naman as the therapist favorite mo yung client mo o bakit ba ayaw mo sa kanya? So most likely na ipoproject mo sa kanya yung mga significant others mo din. Now according to Sigmund Freud, you know, if you're to follow psychoanalysis, very important ang transference and counter-transference. Why important ang transference? Kasi dito siya nagpa-practice ng blank slate, no? Kasi para makita na natin yung reaction ng patient. Yung counter-transference naman is very important kasi you get to know yourself as the therapist. No? So kung halimbawang meron kang negative emotions o kaya positive emotions towards your client, what is wrong? No? So that is something na kailangan you have to really work on. And then yung classical psychoanalysis at psychodynamic psychotherapy, the same lang yan. No, ang pinagkaiba lang kasi dito, when we say classical psychoanalysis, ito yung pinapractice talaga ni Sigmund Freud, na yung may couch, no, merong free association, dream analysis, slip of the tongue, tapos transference, counter-transference. Pag sinabi kasi psychodynamic psychotherapy, same din naman ito ng psychoanalysis. However, mas modern na siya. No? So dito, talagang meron ng involvement ang therapist kasi sa classical psychoanalysis yan no, in case na you might encounter this term, talagang Sigmund Freud will just simply listen to you, ganun lang, no. Pero sa psychodynamic psychotherapy, they still practice the techniques, no, kaya lang may involvement na si therapist, no, talagang nakikipag-usap siya sa client. So yan yung differences ng dalawa. So these are the 5 stages of psychosexual development. No, review then. A development period in which the individual pleasure must be gratified if personality development is to proceed normally. So we have the oral phase, no, yung birth to 18 months, the anal phase 18 to 36 months, the phallic phase 3 to 5 years old, latency is 5 to 11 or 13 years old, genital, no, 11 or 13 years old. So yung first stage, the oral stage, this is birth to 18 months. Now, what is the erogenous zone? So the mouth, developmental task is swallowing, no, sucking and biting. So infants who do not get their food and love may later develop greediness, no. So meron ding dito factor yung weaning. No, when we say weaning, yung pag-awat sa bottle feed, no, ng baby o kaya breastfeeding, pwede din siya, no. So ang weaning, W-E-A-N yan. So usually according to Sigmund Freud, no, if parents are very accommodating, no, and very much available, the child may develop the oral incorporative, also known as the taking in, no, yung personality niya. What are the personality traits? Usually overly dependent yan, gullible, no, pwedeng highly optimistic, they're actually the good listeners, no? Ito yung mga talagang very good daw na maging counselor or therapist kasi they really listen. Kasi taking in lang yan, no? Tanggap lang sila ng tanggap. And then these people also love to collect things, no? They also smoke, pero not as aggressive as those sa oral aggressive type of personality. So yan yung sa oral incorporative. Pag oral aggressive naman, no, ito yung if parents are not available to the needs of the child, kasama dito yung eruption of teeth, no, kasi masakit siya. Even yung weaning kapag very aggressive ang parents, most likely the child will develop destructive behavior, hostile, sarcasm, no, they love to ridicule other people, they're very argumentative, no, they talk too much, no, and then ito yung nag-o-oversmoke na. No, so yan yung this is about the oral stage. Yung anal stage naman, 18 months to 4 years old, this is a critical stage or crucial stage for kids. No, kasi dito na yung carry over rebellion towards authority, no, meron ng compulsive orderliness and messiness. Papasok dito yung toilet training. So what is the erogenous zone? That's the anus, developmental task, no, elimination of feces, o kaya urinating, no, pwede din siya. So if the toilet training is not going well, no, if the child has difficulty, no, learning, or the parents are excessively harsh and demanding, no, the child reacts in one of two ways to this situation. It's either, number one, to defecate when and where it is forbidden by the parents. So pagka ganito, the child will develop anal expulsive, aggressive type of personality. So this is the basis for all forms of hostile, no, and sadistic behaviors in adult life, including cruelty, destructiveness, and temper tantrums. So yung mga may anal expulsive, aggressive type of personality, sila yung mga messy, careless, no? Pero ang positive naman daw dito, they're very forgiving, no? Kasi nga, labas lang sila ng labas. And then yung anal retentive type of personality, ito yung another reaction, no, of the child to the parental demands, is they hold back, no, they hold back or retain the feces. So according to Freud, no, this produces a feeling of pleasure, no. So this is a technique for manipulating the parents. So ito yung pag sinabing retentive, talagang ito yung pinipigilan nila, no, yung kanilang pupo o yung wiwi nila, kasi nga para hindi na magalit si mommy tsaka si daddy. So usually they are described as being stubborn, no, stingy, rigid, compulsively neat, overly conscientious, no, they also love to hoard, orderliness, and perfectionist. And then the phallic stage, this is actually one of the most complicated and controversial of Freud's stages. Approximate years is 4 to 5 years old. Developmental task, the manipulation of the genitals, and they explore their bodies. Yung kanilang erogenous zone is the genitals. So the basic conflict of the phallic stage actually centers around the unconscious incestuous desire of the child for the parents of the opposite sex. No, accompanying this desire is the unconscious desire of the child to replace or even destroy, no, the parent of the same sex. So yung Oedipus complex, no, pagtandaan nyo lang yung letter O, baka ma-stress, baka matanong sa board exam at bigla kayong na-stress. Basta pag O, boy yan, no, boy. No, boy sexual incestuous desire towards the mother. So nawawala lang kanyang incestuous desire because of this so-called castration anxiety, no, the fear that his father will cut off his organ. So because of this castration anxiety, he is forced to repress his sexual desire for his mother. So pagka na-repress na yan, nagkakaroon na ng resolution of the Oedipal conflict. Pag na-resolve na ang Oedipal conflict, dito na ang start ng development of a strong identification with the father. So meron siyang set of values, no, morals, attitudes, and gender-related behaviors. So ito na yung sasama na siya kay daddy, no, do manly activities. So dito na yung tinatawag nating like father, like son. So that son will imitate the attitude of his father in order to retain the love of his mother to him. So this is now after the development of superego. No, so I think Sigmund Freud was able to theorize this because Freud at age 4 years old, no, had an incestuous desire towards his mother. And then yung Electra complex, E naman, no, tandaan lang na girl yan, no, GE, girl. Yung O talaga sa boy, tapos yung Electra complex for girls. No, girl incestuous desire towards her father. So the father becomes the girl's new love object. No, kaya lang wala kasing castration anxiety dito kasi wala namang puputulin. Ang meron dito is the penis envy, no? Pero ang penis dito associated with power, no? How come daddy gets to drive the car? How come daddy gets to decide at home, no? How come daddy earns money, no? So ang belief ng bata dito it has something to do with the power, no? So believe na kaya lang itong penis envy is believed it would never be totally resolved, no? So there's a less need for the girl to resolve her phallic conflict, no, than for the boy. Pero darating pa rin daw, no, based on according to this theory, na merong resolution, no, the girl does come to identify with her mother and repress her love for her father. So the same then, no, same as with the boys, pag nagkaroon ng resolution of the Electra complex, there's also a strong development of a strong identification with the mother. So yung set of values, moral attitudes, and gender-related behaviors nagkakaroon na siya. Sasama na yan kay mommy, no, gagawa sila ng mga womanly activities. And then papasok din dyan yung like daughter, like mother, like daughter. So, and then after that, no, the development of the superego. Yan. So pagka unresolved ang phallic stage, no, the person who displays extreme fear, aggression, and other difficulty in dealing with a boss, no, teacher, or other authority figure may be demonstrating unresolved conflicts with his or her same-sex parent. No, kapag halimbawa ang batang lalaki, tumanda yan, hindi niya makasundo ang same-sex na boss, no, most likely hindi na-resolve yung kanyang Oedipus complex. Same as with girls. No, pero of course, theory lang naman ito. And then there's also one na pag unresolved ang phallic stage, no, mayroong uncertainty about one's sexual identity as a male or female. And then possible din na magkaroon ng problems when it comes to maintaining stable love relationship. Kasi hahanap siya ng partner na kaugali ng parent niya. No, so yan. And then very crucial ang stage din na ito kasi dito din yung stage wherein the child, no, plays or explores his body. No, pag ang parents very hostile, no, o wag mong hawakan yan, no, puputulin ko yan. Ito rin yung mga causes kung bakit very inhibited yung mga sila, no, inhibited na mag-discuss about sexual matters, o kaya ito rin yung may mga cases ng may exhibitionism, o kaya they also resort to excessive masturbation. So yan. And then latency stage, develop at age 6 to 11 years old. Ito na yung grade school tayo dito. No, this is a very quiet period of development. No, why quiet? Kasi walang erogenous zone. No, kids at this stage are very much focused on their school tasks. So tapos they like to be with their own same sex, no attraction to the opposite sex. Kaya meron ditong latent homosexuality. Now, when we say latent homosexuality, it's temporary because all they want is to be with their same sex. Diba? Nung bata tayo, all boys, all girls. Minsan merong girls versus boys. So it's not a disorder again, no, ang homosexuality, but it's just a lifestyle. So sa latency stage, no, this is where the id, ego, and superego begin to crystallize. And then the last one is the genital stage, no, 12 years old to adult. This is the longest and extends far beyond adolescence. There's now attraction between opposite sex. Now, the child is sometimes transformed from selfish pleasure, no, seeking child to realistic socialized adult, typically with heterosexual interest, no, leading to marriage and perhaps child rearing. So this is the longest, kasama na yan dyan yung career, no, earning money, properties, no, post old age. Okay, and then yung later developments in psychoanalytic thought, now we have Anna Freud, concentrated on the way in which the defensive reactions of the ego determine our behavior. The first proponent of the modern field of ego psychology. Anna Freud is the daughter of Sigmund Freud. No, Heinz Kohut, no, focus on a theory of the formation of self-concept and the crucial attributes of the self that allow an individual to progress toward health or conversely to develop neurosis. Now, this psychoanalytic approach became known as self-psychology. Carl Jung introduced the concept of the collective unconscious, which is a wisdom accumulated by society and culture that is stored deep in individual memories and passed down from generation to generation. So emphasize the importance of enduring personality traits such as introversion and extroversion. Alfred Adler, no, yung focus on the feelings of inferiority and the striving for superiority, he created the term inferiority complex. No, Karen Horney, the neurotic needs, no, yung compliant, aggressive, and withdrawal. And then we have Eric Erickson, yung stages of psychosocial development niya. Then we proceed to humanistic viewpoint on the outgrowth of and reaction to the psychodynamic approach. Actually, many humanistic thinkers were trained as psychoanalysts. No, so kaya lang iba, they do not agree with Sigmund Freud's theory. That's why they were able to come up with something new. Ang focus nito is more on a person's positive qualities, no, his or her capacity to change, and the promotion of self-esteem. So nandito yung yung kay Abraham Maslow, yung hierarchy of needs. So self-actualizing is the watchword for this movement. So ito yung kay Abraham Maslow, the hierarchy of needs is a series of needs that must be met in the process of development before the adult can begin to pursue self-actualization. So this yung self-actualization describe a person who has achieved all the needs of the hierarchy and has developed his or her fullest potential in life. No, pagka na-achieve na ng tao yung kanyang self-actualization, mabilis na yung kanyang coping. Kasi a person with self-actualized can always go back to from the very start, yung physiological needs. Pag nagkasakit yan, okay, let's say nalugi sa business, yun lang, dahil self-actualized na siya, mabilis ang coping, naintindihan niya yung life is not fair, naintindihan din niya na hindi pwedeng lahat makuha, he enjoys his own company, so yan yung mga self-actualized So yan, meron silang individuality talaga, that is yung kanilang single master motive is self-actualization. So kailan papasok dito ang abnormality? When the drive towards self-actualization is blocked, so this is the psychopathology of the normal. Kaya dito papasok yung magtataka tayo, ang dami namang resources, ang daming pera, pero bakit hindi siya masaya? Kasi nga na-block yung kanyang drive towards self-actualization. Something is still missing. Meron dito sa levels na yan. Carl Rogers is the proponent of the therapeutic relationship, yung kanyang client-centered therapy, now known as the person-centered therapy, focus on the therapeutic relationship and develop a new method of client-centered therapy. The first one to use the term client rather than patient, and then change to person. So kasi pag person, general ang term niya. So this focuses on the role of the client rather than the therapist as the key to the healing process. Ang rationale kasi ni Carl Rogers dito, believe that each person or are the best person to know their own experiences and make sense of them, to regain their self-esteem and to progress towards self-actualization. So sa kanyang unconditional positive regard, unqualified acceptance of most of the client's feelings and actions, at saka yung empathic understanding. So, unconditional tsaka empathic understanding, even genuineness, kay Carl Rogers yan. These are the three central concepts to promote the client's self-esteem. So, what's the difference between empathy and sympathy? Yung empathy kasi is we co-experience. Ang sympathy naman, we simply understand and support. So which is more therapeutic between the two? Empathy is more therapeutic kasi sa empathy, we co-experience dahil naintindihan natin yung nararamdaman nila, we help them. Tutulungan natin siya to regain his self-esteem. Yung meron siyang assignment, meron siya talagang gagawin. Pero ang sympathy dahil naawa tayo sa kanila, what's the tendency? Ibibigay lang natin sa kanila lahat. So without even really helping them in the end. So empathy is more therapeutic than sympathy. So how to express empathy? So mga lang ito, mga reminders lang. So yan, say mental disorder, mental illness, or psychiatric disability. Avoid saying crazy. In the Philippines, we make use of baliw. May sayad, dapat hindi ginagamit yan. Say person with bipolar disorder, a person who has schizophrenia. So avoid saying manic, bipolar, schizophrenic, or demented because these are terms that emphasize limitations and depersonalize. So the humanistic model actually contributed relatively little new information to the field of psychopathology. Very limited lang ang contribution niya kasi nakafocus talaga siya sa positive traits ng tao na hindi masyadong nakapag-research when it comes to the field of psychopathology. Existentialism, Now, believe that behavioral deviations result when a person is out of touch with himself or herself to the environment. Now, emphasizes our uniqueness or as individuals in our quest for values and meaning, and in our freedom of self-direction and self-fulfillment. So yung existential anxiety, this was created by the realization of our ultimate debts, leads many people to abandon their personal growth and search for meaning. So dahil marami tayong mga existential anxiety, no, nawawala yung ating meaning to life. So proponent includes Viktor Frankl, no, yung prime motive of human behavior is not the will to pleasure but rather the will to meaning. So this is again against Sigmund Freud. So yung kay Sigmund Freud kasi a will to pleasure, pero kay Viktor Frankl is the will to meaning. So we live, no, dahil meron tayo makabuluhan na dahilan. No, Viktor Frankl is the proponent of logotherapy, wherein it confronts patients with their responsibility for their existence and help them choose values. Yeah. And then we move on to behavioral perspective. So ang psychoanalytic kasi is what you see is not what you get, no? Kasi it's more on introspection, no? Kasi usap tayo na usap. Pero ang behavioral, no, what you see is what you get. So views behavior as the result of learning, also known as social learning model. It brought the systematic development of a more scientific approach to psychological aspects of psychopathology. So what's the background? So this is this has something to do with introspection, no, claims that the causes of behavior need not be sought in the depths of the mind, but could be observed in the immediate environment. So the rise of behaviorism class is actually credited to Watson. No, he is considered as the father of behaviorism kasi siya talaga ang pinakamaingay sa lahat. So sabi niya, if we want psychology to become science, we have to study what is observable, no? Kasi nga naman yung nasa thoughts natin hindi siya observable. No, psychology as the behaviorist views it is a purely objective experimental branch of natural science. Its theoretical goal is the prediction and control of behavior. So introspection forms no essential part of this method. So Watson spent most of his time developing behavioral psychology as a radical empirical science, but he did spend time briefly in the study of psychopathology. So I'm sure you still remember the experiment, yung kay Little Albert tsaka yung kay Peter. Yung kay Little Albert, ito yung they were able to understand na pwedeng makondisyon ang phobia, pero kay Peter naman, no, pwede rin mawala ang phobia. Yan. So we have Ivan Pavlov, yung kanyang classical conditioning, also known as Pavlovian conditioning, a type of learning in which a neutral stimulus is paired with the response until it elicits the response. So dito yung unconditioned stimuli, unconditioned response, no, conditioned stimuli, conditioned response. This is very easy. Pag first time, unconditioned stimuli yan. Tapos first time din ang kanyang response based on the stimuli, unconditioned response. If you are to conduct the same experiment the next day, so magiging conditioned na siya. No? So conditioned stimuli, tapos conditioned response. Someone is raising her hand, tama ba? May question po. I hope this is clear kasi parang madalas itong matanong din sa boards, no? So pag sinabi natin unconditioned stimuli, first time, let's say nag-ring ang bell, first day natin i-conduct ang experiment, ngayon natin siya i-conduct. So pag narinig mo yan, yung bell na yan is the unconditioned stimuli. So kung nagulat ka, that will be your unconditioned response. No? So after nun, gagawin natin ulit yung experiment after a week. No, pagka narinig mo ulit yung bell, conditioned stimuli na siya, no? Kasi narinig mo na siya the first time noon eh. Tapos kapag nagulat ka ulit, conditioned response siya. No? So pag first time unconditioned, pag second time conditioned na siya. So B.F. Skinner's the operant conditioning. No, B.F. Skinner is the proponent of operant conditioning. Now, this is a type of learning in which behavior changes as a function of what follows the behavior. Now, yung reinforcement ito, now, behavior is increased or maintained by rewarding consequences. So punishment, of course, acts to suppress responses. And then Skinner coined the term operant conditioning because behavior operates in the environment and changes it in some way. And then we have cognitive perspective. Views abnormal behavior as the product of mental processing. Cognitive behaviorism, this is wherein cognitive processes and their impact on behavior. Actually, nagsanib ito, no, nagsama sila. Ang background naman ng cognitive perspective is the stimulus response approach. So sabi ng mga cognitive psychologists naman, hindi naman kasi lahat ng tao pare-pareho ng reaction, no? Let's say if I show you a new picture of a man, no, pwedeng iba-iba ang response, no? Merong stimulus pero iba-iba ang response, no? Kaya bakit ba may mga tao na galit pero tahimik lang, no? Bakit ba may mga tao na galit pero nagwawala sila? So kasi it has something to do with the cognitive perspective, no? Pero they join forces kasi kung ano yung nasa cognition natin, yun din ang makikita sa behavior natin. So first in line, we have Albert Ellis. No, most of our problems stem from our irrational beliefs. No, sa kanya yung rational emotive behavior therapy. So this is ito yung kanyang guiding principle. No, yung according kay Epictetus, people are disturbed not by events, but by the views which they take of them. So the view of human nature of Albert Ellis is that human beings are born with a potential for both rational or straight thinking and irrational or crooked thinking. So what's the root of our irrational thoughts, no, from significant others during childhood? No? Yung mga expectations ng parents na very impossible. That's one reason bakit may mga irrational beliefs tayo. So this refers to the should, must, oughts, no, mga demands and commands, no, yung mga dapat, no, dapat ganito, dapat itong gawin ko. So how to attack yung mga should and must and oughts, no, we have to make use of the ABC framework, no, yung activating event, no, belief. The letter C stands for emotional and behavioral consequence. Letter D, the disputing intervention. E, effect. Tapos F is the new feeling. So let's say, for example, this is the B. Tapos letter C, emotional and behavioral consequences. Yung letter A, a student failed his exam. That is the activating event. Ang belief niya, I should not fail. Kaya lang, yung belief na ito is the one that makes the student to feel bad, no, and sad. No? Kaya hindi yung activating event. So if you notice yung arrow nakafocus sa letter C, no, yung belief natin about failing the exam is the one that makes us feel bad and sad. So paano ito i-correct? No, we have to letter D, yung dispute the intervention. No, we have to detect our irrational beliefs, no, debate, question and argue, and then discriminate irrational beliefs from rational. So dito na papasok yung cognitive restructuring. No, this is a central technique of cognitive therapy that teaches people how to improve themselves by replacing irrational beliefs with rational beliefs. And then followed by Aaron Beck, no, proponent of the cognitive therapy. Yung kanyang cognitive therapy is the result of his research on depression. So what are the basic principles of cognitive therapy? Yung mga automatic thoughts naman ito. Automatic thoughts, mga cognitive distortions. So yung bigla, kasi ito usually ang mga thoughts ng mga may depression, di ba? Yung bigla, nasagi mo ang thoughts niya, ay galit siya sa akin, no? Mabilis ang thoughts nila na ganyan. So usually para to dispute this is the frequently asked question, what is the evidence for? No? Paano mo nasabi na galit siya sa'yo? No? Hindi mo naman ata siya kilala, mga ganon. No? To dispute yung kanilang mga automatic thoughts and cognitive distortions. Interpersonal perspective, no, analyzing behavior as a function of the person's relationship with others. No, psychological disorder are not necessarily problems of the person, but it results from disorder of relationships. So when we say interpersonal perspective, kasama dito yung relationship with the family, no, neighbors, o kaya friends. No, so papasok dito yung communication theory. No, the psychopathology results from faulty communications. Yung double-blind communication, one person presents another with a contradictory message. Oftentimes, the cause of schizophrenia, no, based on study, magkaiba, no, may sinasabing maganda pero opposite naman ng behavior, no, mahal kita anak pero iba ang behavior, no, so nalilito ang bata. Pag sinabi ng parents na gusto ko mataas ang grades mo, ang tataas naman ng grades, line of 9 na lahat, pero bakit pinagagalitan pa din? So double blind communication, may contradictory message. Enmeshment is over-involvement, no? When adults at home are always under your nose, no? Talagang laging hinahanap, laging nagtatanong, laging may negative feedback. Pag disengage naman, this is also one factor, under-involved. No? You want someone to talk with, pero wala ang family sa bahay. No? It can also be one factor to cause disturbance. No, yung family system theory, see family as a complex system which works to maintain the status quo or the homeostasis. No, pwede kasing functional or dysfunctional ang family. No, when a member of the family has psychological disorder, family systems theory see it not as a problem within the individual, no, but as an indication of a dysfunctional family system. So psychopathology in an individual reflects pathology or dysfunction in the family. So ito naman yung sinasabi ng interpersonal theory. Of all the psychological disorders class, no, ano yung psychological disorder na talagang masasabi natin may problema sa bahay? It's the eating disorder. No, pag ang pasyente may eating disorder, most likely may problema sa bahay. Either, ang cause kasi niyan ang family can be very rigid, perfectionist, manipulative ang parents, at saka over-involved sila. No? So, of all the psych disorders, ang pinaka number one disorder talaga na masasabing may problema sa bahay, it's the eating disorder. Yeah, so projection of family problems or expectations onto individual members includes scapegoating. Now, one member is blamed or made to suffer for problems in the family. So, mayroong sinisisi, no? So, siya kasi may kasalanan, bakit naghiwalay ang parents? Siyang may kasalanan, bakit nalugi ang business? Identified patient, no, one member develops more outward symptoms of pathology as a result of family problems. So sa family members, merong talagang isa na affected. No? Pwedeng ito yung laging absent sa school, napapaaway sila, no? Na bumababa ang grades. Labeling, members are identified by one or more characteristics. No? So labeling, no? So siya ito, tamad yan, tamad siya, magulo siya, pasaway siya. And then systematic situation, schism exists in a couple's relationship, creating a situation wherein the child or children must take sides. So ang tawag dito systematic situation. Kapag maghihiwalay ang parents, pinapipili ang bata. Skewed situation, skew exists in the marriage relationship because one member is dysfunctional, no, leading to an imbalance of roles or wellness in family relation. No, pwede dito halimbawa ang father may malubhang sakit, no, pag dahil meron siyang sakit, si mommy ang magtatrabaho. So sinong maiwan sa bahay para sa mga bata? Pwede yung elder, yung pinakapanganay na sana nag-aaral siya, no, pero nag-aalaga siya ng batang kapatid. So skewed situation ang tawag doon. Yeah, sociocultural perspective, no, this suggests that we need to look beyond the family to the larger society to find the causes of psychopathology in individuals. No, the psychological ills, no, are the result of the social ills. So dito naman papasok yung mga kultura, no, practices at saka beliefs. So society can create stresses on individuals that increase their risk for psychopathology. Some people live in more chronically stressful circumstances than others, and these people appear to be at greater risk for psychopathology. Now, societies may influence the type of psychopathology their members show by having implicit or explicit rules about what types of abnormal behavior are acceptable in what circumstances. So one example dito yung Amish community. No, ito kasi sa Amish community, very lang sila, closed community ito. So talagang sabi, they do not have any electricity. Talagang yung makaluma ang practices nila. Pero may iba na lumalabas na di-discover nila na pwede naman pala maging religious pa din. And then you get to also enjoy yung mag-aral sa university, no, you get to use the internet connection, mga ganyan. No, pero based on research, they are depressed. Kaya lang when they conducted another research, mas depressed pala yung nasa labas kaysa yung nasa loob ng community. No, kasi nga tayo, 'di ba, we have this competition, we compete, 'di ba? We may mga demands ang mga tao sa atin, pero sila very simple kasi yung life nila. So sa community nila, they found out na they're depressed. Tapos when another researcher conducted another research, nung kinumpare naman sila sa mga nasa labas, mas depressed pala yung nasa labas compared sa grupo nila. So we also have this so-called culture-bound syndromes. No, so din to based on the practices, no, let's say amok, a dissociative episode, practices and beliefs, no, and culture of a society. No, ang amok is a dissociative episode characterized by a period of brooding, followed by an outburst of violent, aggressive, or homicidal behavior. This is very common in Laos, Philippines, Polynesia, Papua New Guinea, and Puerto Rico. No, when we say amok, ito yung nagwawala. Koro, a fear that one's penis might shrink and he will die, no, appears after excessive masturbation or sexual overindulgence, no, common in Malay Peninsula. Ang Windigo is believed that he is bewitched and will eventually turn into a cannibal, no, common among Algonquin Indians. Kitsunetsuki, no, victims believe they are possessed by foxes and are said to change their facial expressions to resemble foxes, no, common in Japan. So marami pa ito. If you have a copy of the DSM-4, nasa ano siya, nasa appendices siya. Meron pa yan sa China, yung paleng, no? Yung when we say paleng, takot kasi silang ginawin, so they wear different layers of clothes. No, ang tawag doon is paleng. Tapos meron pa rin sa Japan yung Taijin Confucio, no? Yung fear nila na baka they might embarrass people, no, because of body odor, no? Kaya ang mga Japanese, they do not maintain eye contact. So ano yan? That's part of their culture. And then came the biological perspective. No, ito naman iba na. No, so this explains the relationship between the physical and psychological aspects of functioning. No, hindi na ito yung makaluma yung medical model nung unang panahon na kapag let's say hysterical yung babae, not in place yung kanyang uterus. Pero dito sa biological perspective in the modern world na, they studied the parts of the brain, no, yung neurotransmitters at saka yung hormones. So we'll discuss more on this dun sa causes. Baka you have any questions or you might want to have mga 2 minutes bladder break. Okay. Hello. Sige, let's start. Before we proceed to the etiology of abnormal behavior, I just want to share to you yung mga predisposing factor, no, yung precipitating factor. I think andito yung sa etiology. No, I'm sorry, I got confused. So akala ko yung sa theories siya. So dito sa etiology of abnormal behavior, so when we talk about etiology, this refers to the causes. So So there are two ways to understand the etiology of abnormal behavior. Number one, yung multidimensional integrative approach. Number two is the one-dimensional. So when we say multidimensional, dalawa, no, o kaya marami. It can be biological, it can also be psychological. So dito papasok yung nature at saka nurture. Tapos yung one-dimensional, no, this trace the origins of behavior to a single cause. So isa lang ang iniisip na dahilan bakit nagkaroon ng deviant behavior. So pwedeng halimbawa, the main cause of a certain psych disorder is due to the imbalance of neurotransmitter. O kaya the main cause is because nagkaroon ng separation sa family. So yun lang ang tinitingnan. So pag sinabing multidimensional, mas marami. So pero based on by practice talagang we consider the multidimensional kasi we cannot identify a sole cause of a certain psych disorder, no, talagang wala. Kaya kapag let's say you encountered a question na which of the following is the sole cause o kaya which of the following is the main reason for the development of depression, kapag ka nandun ang choice na unknown ang sagot, no. Pero pagka halimbawa naman ang question which of the following biomedical, no, is the cause of depression? So pag sinabing biomedical, ano yan? Diyan papasok ang biological dimension. So talagang may sagot siya. No? So yung unknown, pwedeng sagpiliin yan kapag ang tanong ay the main reason. Kasi wala talagang main reason. We cannot identify. We always make use of the multidimensional and not the one-dimensional. So, no influence operates in isolation. No, each dimension is strongly influenced by the others. So let's say, for example, a case of Judy, no, yung phobia of blood. So how to understand yung kanyang phobia? We have to consider the behavioral influences, no, yung kanyang learning. No, bakit ba siya may phobia? Baka mamaya sa bahay meron din palang ganon. No? So nakikita niya yung behavior ng adults. Number two, yung biological, no, baka inherited yung kanyang yung vasovagal syncope kasi ito yung ating tendency to faint, no, pwede itong mamana sa parents natin. So pagkaroon ng vasovagal syncope, the heart rate and the blood pressure increases accordingly. Kaya ang tendency nahihimatay, no, ito namamana talaga siya, no, biological influences yan. Number three is the emotional influences. So emotions can actually affect physiological responses. No, kapag let's say heighten ng emotion, no, talagang emotional siya, so pwedeng ma-affect yung physical, no, pwedeng increase heart rate, increase blood pressure, increase respiration. So what's the tendency? No, pwede din talagang makiliti yung kanyang vasovagal syncope niya, talagang mahihimatay siya. And then social influences, no, yung social being, we also learn how to interact with people. No, we live in groups such as families. So kamusta kaya ang support system niya? Baka mamaya they tend to tolerate o baka merong pressure, no? So o kaya too much attention, o kaya baka naman may rejection, no? Baka pinagtatawanan siya, kaya lalong nahaheighten yung kanyang phobia. Developmental, so many things about ourselves and our environments change in important ways, no, causing us to react differently at different ages. No, bakit ba let's say si Judy, sabi natin 16 years old, bakit ba doon pa siya nagkaroon ng phobia? No, kasi pwedeng at age 16 doon lang siya nagkaroon ng susceptibility to yung vasovagal reaction niya. O kaya talagang doon nagmanifest yung talagang symptoms ng kanyang phobia. No, possible siya. Kasi ang phobia talaga nagma-manifest yan sa childhood. No, pero developmental influences, it varies. So yung perspective on causation, so ito yung na-discuss natin kanina, no, yung pag sinabing biological, it has something to do with organic conditions. No? Pag sinabing organic, physical yan. No? Psychoanalytic, unconscious psychological conflicts. Pag sinabing behavioristic, no, psychological disorder is due to faulty learning. Pag cognitive behavior, it's due to maladaptive ways of perceiving and thinking. Humanistic existential, this is due to blocked or distorted personal growth. Interpersonal, relationship with others. Ang sociocultural, the pathological social conditions such as poverty, no, prejudice, and discrimination. So the genetic contributions to psychopathology, we have in our physical traits and characteristics, even personality, no, are inherited from our parents. No, even yung color of our hair, no, eyes, height, these are influenced by our genetic endowment. No, affected, of course, pwede siyang ma-affect ng environment. No, let's say for example, the food we eat, no, the air we breathe. No, kaya minsan nagbabago yung ating physical characteristics. No, pwedeng namana sa parents, halimbawa lahat ng kamag-anak slim, no, pero halimbawa ako mataba, no, pwedeng affected ito ng environment. So, pwede din yan. And then, environmental factors, no, in the form of social and cultural influences can determine whether genes are turned on. So, big factor ang environment. So, let's say, for example, children of parents with schizophrenia who were adopted away as babies. So, ito, ginawa nilang research, sinubaybayan yung paglaki ng mga bata. So, yung mga bata na ito na adopted by a functional family, no, hindi nag-manifest ang signs and symptoms ng schizophrenia, pero yung another baby adopted by a dysfunctional family, nag-manifest yung signs and symptoms ng schizophrenia. So based on that research, no, pwedeng masabi na hindi porke nasa genes talagang meron agad. No? So environmental factors also play a very important role, no, in the development of psychological disorders. So yung diathesis stress model, individuals inherit tendencies to express certain traits or behaviors which may then be activated under conditions of stress. Now, pag sinabi nating diathesis, this refers to inherited tendency to express traits or behaviors. Genetic siya, no, namamana ang diathesis. Pag sinabing stress, this refers to life events or contextual variables, or also refers to the environmental factor. So combining both no, yields activation under the right conditions. So this is one example. No, yung red line doon is a disorder. Yung pinaka-dark brown refers to the diathesis, the genetic vulnerability. Tapos yung life events, yung stressors, yung light brown. So if you are to compare person number 1 to person number 2, yung person number 1 becomes alcoholic kasi mas madami siyang diathesis compared to person number 2. Tapos pareho naman sila din ng stressors, kaya lang dahil mas marami ang diathesis ng person number 1, kaya mas malaki ang chance niya na maging alcoholic. So ibig sabihin, pwedeng both parents, no, o kaya pwedeng sa kamag-anak na mana niya talaga yung genes. So kaya mas malaki ang chance niya to develop the disorder. So ito namang reciprocal gene environment model, no, genetic endowment may increase the probability that an individual will experience stressful life events. So genes shape how we create our environments. So yung inherited predispositions or traits that increase one's likelihood to engage in activities or seek out situation. So ano ba yung sinasabi ng reciprocal gene environment model? In some way, because of our personality, parang we will experience the same situation, no, unless magkaroon ng self-awareness. So let's say for example ang divorce, no, bakit ba nakakailang divorce na, nakakailang marriage na, lagi pa rin nagdi-divorce, tapos marriage ulit, das divorce ulit. So wala kasing tinatawag na divorce gene, no, hindi naman na yon. Pwedeng naman na yung mga traits and personality from our parents. Let's say for example, kaya pala laging hindi tumatagal ang relationship kasi this person is too aggressive o kaya too dominant. No? So hindi tumatagal ang partner, kaya nagdi-divorce sila. So pag kami self-awareness, naku, kailangan ko baguhin ito, saka mababago din yung environment. No? So another example dito, yung bully. No? So hindi naman mana yung bully genes. No? Bakit ka ba madalas mabully? No? So ang namana dyan is the traits o kaya yung personality from the parents. Let's say you are very submissive. You do not assert yourself. Kaya naman kahit nakailang transfer na ng school, talagang nabubuli pa din. No? So papasok talaga dyan ang self-awareness. So you have to learn how to assert, you have to learn how to stand out, no, para mabago yung situation, para mabago yung buhay. No? So ito yung in-explain ng reciprocal gene environment model. So this is also one example. No? Yung person A has genetic vulnerability to develop blood injection injury phobia. Tapos yung person B does not have genetic vulnerability to develop blood injection injury phobia. So ito, mas malaki yung kanyang tendency, si person A, mas malaki yung kanyang tendency to develop phobia kasi meron siyang tendency toward impulsiveness. No? So, yan So, it attracts situation that might involve blood. No? So, mas nagkakaroon ng malaki yung chance na malagay tayo sa ganung sitwasyon kasi meron tayong trait No? Yan, tendency toward impulsiveness. No? So, compared sa person B na wala, no? So wala siyang tendency. So mas lesser ang chance kaysa kay person letter A. So the neuroscience and its contribution to psychopathology. So dito papasok yung the field of neuroscience, no, how the nervous system, pag sinabing neuroscience, the nervous system, especially how the brain works, no, is central to any understanding our behavior, emotions, and cognitive processes. So this is part of our brain, our nervous system. It is composed of the CNS, the central nervous system, at saka yung peripheral nervous system. Our CNS is composed of the brain and the spinal cord, while the peripheral is composed of the autonomic, the somatic, tapos autonomic is divided into two, the sympa and the parasympath. So yung somatic natin allows you to move and control muscles throughout your body. Tapos yung autonomic, ito yung automatic, no, yung breathing, no, yan, yung blinking of the eyes, tapos divided into sympa tsaka para. No, pag sinabi nating sympathetic, kapag may adrenaline rush, pagka parasympathetic, ito yung na-pacify ka na. No, from the term para, di ba? Pag nakasakay ka sa jeep, pag nagpara, titigil yan. So same din sa'yo. Pag napagod ka o tumigil ka sa kakalaro ng basketball, saka ka palang magugutom or mauuhaw. And then, these are the parts of the brain that is central to the study of psychopathology. No? The limbic system. This is responsible for emotions, no, the basic drives, at saka impulse control. No? Pagka may impulse control, dito papasok yung addiction. So most likely, pag may addiction, ayan, ito yung part ng brain na nagtatrabaho talaga. Tapos yung basal ganglia, responsible for motor activity. The forebrain, or the cerebral cortex, most sensory, emotional, and cognitive processing. It contains more than 80% of all the neurons in the CNS. So it allows actually people, or it allows us, with our distinctly human qualities, to look to the future, plan, to reason, and to create. Nasa forebrain natin yan. And then, before this, I add hypothalamus. No, so yung hypothalamus is also responsible for homeostasis, no, yung food intake natin, even body temperature. Diba yung ating hypothalamus is composed of two parts, the ventromedial and the lateral. When we say ventromedial, this refers to satiety center. Yung lateral naman is the hunger center. So pag may eating disorder, most likely may problema sa hypothalamus. No, so ventromedial satiety, pag nagugutom ka na, pag nabusog ka na, ang lateral hypothalamus ang nagtatrabaho. Hypothalamus is also responsible for sex drive. No, yan. And then we have neurotransmitters. These are biochemicals that are released from the axon of one neuron and transmit the impulse to the dendrite receptors of another neuron. So major neurotransmitters relevant to psychopathology include norepinephrine, also known as noradrenaline, serotonin, dopamine, gamma-aminobutyric acid, or also known as the GABA, and the glutamate. So excess or insufficiencies in some neurotransmitters are associated with different groups of psychological disorders. So our neurotransmitters functions as agonist at saka antagonist. No, pag sinabi nating agonist, it increases the activity. Ang inverse agonist naman produce effects opposite, no, to those produced by the neurotransmitters. Ang antagonist naman decrease or block ang neurotransmitter. Ang inverse agonist, example nito yung mga antihistamine, di ba? It inhibits at saka it suppresses. Kasi ang agonist increase So yung inverse babaligtarin niya. Ang antagonist naman block ang neurotransmitter. No, so I hope you got it. No, when we say agonist, increase the activity. Pag sinabing antagonist, it blocks. No, para bumagal ang activity, inverse agonist ang tawag dyan. So most drugs could be classified as either agonist o kaya antagonist. So you might want to check yung label ng gamot dyan sa bahay nyo. May mga description ng agonist o kaya antagonist or inverse agonist. So we discussed number 1, yung glutamate and GABA. Ang glutamate functions as excitatory. No? This is a transmitter that turns on many neurons, leading to action. Now, based on research, they found out na ang glutamate factor din ito sa schizophrenia. No, it's not only dopamine. So no, dopamine of course is the number one, pero nakita na glutamate is also a contributory factor to the development of schizophrenia. So again, ang glutamate, excitatory. Pag sinabing excitatory, it turns on many neurons leading to action. Ang GABA naman is yung kabaligtaran, inhibitory ito. No, it inhibits or regulate the transmission of information and action potential. So this is implicated in anxiety, no, kasi reduce arousal and temper our emotional response. Ang glutamate and GABA actually work in concert, no, to balance functioning in the brain. Ang glutamate and GABA are considered as chemical brothers. Yan. Tapos to add, ang GABA is responsible for reducing level of anger, no, hostility, aggression, and even positive emotional states. Yan, kasi nga it inhibits eh. And then we have serotonin, regulates behavior, moods, and thought processes. No, low levels and vulnerabilities of serotonin actually, ano yan, kapag extremely low, nagkakaroon ng tao ng less inhibition, no, with instability, impulsivity, and tendency to overreact to situations. Pagka low level of serotonin naman, associated with aggression, suicide, no, impulsive, overeating, and excessive sexual behavior. Siyempre, pag mataas naman ang serotonin natin, mania. No? So, ang serotonin is implicated in depression. Pag mababa, depression. Pag mataas, mania. Ang serotonin is believed to influence a great deal of our behavior, no? Particularly the way we process information. So again, if I may repeat, no, pag low ang serotonin, this is associated with aggression, no, suicide, impulsive, overeating, and excessive sexual behavior. Pag extremely low, no, talagang sobrang baba na siya, less inhibition with instability, impulsivity, and tendency to overreact to situations. Norepinephrine, no, also known as noradrenaline, responsible for respiration, reactions, and alarm response, no, implicated in panic, no, ang norepinephrine. Ang dopamine naman, this is considered as a major neurotransmitter, no, so ito yung may switch function in brain circuits, no, interacts with other neurotransmitters, no, implicated in schizophrenia, even in Parkinson's disease. Kaya lang, what's the difference between the two? Sa schizophrenia, pag mataas ang dopamine. Kapag ang Parkinson's, pag mababa ang dopamine. No, kaya a patient with schizophrenia, pag binigyan niya ng gamot ng doctor, antipsychotic drug, bumababa ang level of dopamine. Kaya lang, nagkakaroon siya ng signs and symptoms ng Parkinson's. No, nagkakaroon siya ng tremors, rigidity of muscles, even difficulty with judgment. No, kaya ang tawag doon is the pseudo-Parkinsonism. Kaya hindi dapat maingat din si doctor dyan sa dosages, no, kasi pwedeng sobrang baba na ang dopamine niya, magmamanifest sa kanya ang signs and symptoms ng Parkinson's. Ang dopamine is also implicated in the disorders of addiction, no, even sa depression, kasama din siya, and even ADHD. Yeah. So some research indicates that psychosocial factors, no, directly affect levels of neurotransmitters. Now, the structure of neurons themselves, including the number of receptors on a cell, can be changed by learning and experience during development. So, malaking factor talaga ang environment. Kasi if a child receives love and care, no, merong mga psychosocial treatment, no, talagang very holistic ang environment niya. So, kahit gaano pa distorted yung kanyang mga secretions of neurotransmitters in the brain, pwede siyang mabago, no? Possible. So we move on. Ito yung kanina sinasabi ko na some physical disorders or physical diseases, no, mimics the signs and symptoms of psych disorder. So akala natin psych disorder pero hindi pala. No, that's why it's very important for us to collaborate with psychiatrists. Let's say hypothyroidism, ito merong depression, may excessive sleepiness. No, so ano to pwede nating masabing psych disorders, no, pero hindi pala, no, kasama siya sa signs and symptoms ng hypothyroidism. Even Huntington's disease, no, may hostility yan, irritable sila, meron ding anhedonia. So akala natin may depression, no, pero hindi pala, no, part lang yan ng Huntington's disease. So we have to treat the disease. So this patient needs medication. Cushing syndrome, no, meron silang depression, psychosis, and even insomnia. So akala natin psych disorder pero hindi, it's a physical disease. So same din niya sa mga drugs, no? Kapag ka overdose o kaya pangit ang side effects ng drugs, no, pwedeng magkaroon ng mga signs and symptoms. Pero ang pinaka-worst na pwedeng mangyari dito, iti-treat yung symptoms na yon, no, pero hindi pala talaga. No, so ang pinaka-best way to do is to stop the medication. No, one example is the Tamiflu. Yung Tamiflu na to is in Japan, approved for the treatment of the flu and has gained public attention because of the speculative hope that it might prove useful in the advent of worldwide bird flu epidemic. Kaya lang ang side effect niya, it causes disturbances in consciousness, abnormal behavior, delirium, hallucinations, no, delusions, and convulsions. Another one, itong Ditropan, no, this is a medication for overactive bladder. So kaya lang ang side effects niya, no, meron siyang hallucination. No? She started seeing bugs and insects that were not there and ultimately saw her hands bleeding. So she became very hyper and then frankly agitated and paranoid, accusing her mother of being out to get her. So ang ano lang naman dyan, ititigil lang ang medication. So pagka hindi thorough ang assessment, no, this is actually the very importance of conducting a thorough assessment, baka i-treat pa yung mga additional symptoms, so it can just worsen the situation. No? Yan. Next one is the behavioral and cognitive sciences. So ito yung sa environment, yung learned helplessness described by Martin Seligman. No, so pagka sinabi nating learned helplessness, merong mga control issues, yung perceptions of control, also implicated in depression, no, yung hindi ko nakakayanin ito, no, kahit may paraan pa. No, so people become depressed, no, if they decide or think they can do little about the stress in their lives. No, even it seems to others that there is something they could do. So learned helplessness ang tawag dyan. Of course, pag may learned helplessness, nagkakaroon ng negative attributions. No? Yung I cannot control this anymore. No? Ganito na siya talaga. Kaya lang, Martin Seligman also proposed this so-called learned optimism. Kasi this is the opposite of learned helplessness. No? If people faced with considerable stress and difficulties in their lives, no, display an optimistic, no, upbeat attitude, no. Ito naman yung mga kaya pa, no, kaya ko ito, no, so may paraan, no, so gagawa ng paraan sila yan. Kaya this is actually the main reason why yung positive psychology, no, was introduced, no. This is actually a new branch of psychology. Factor ito ng better psychology and physical psychological makeup, no? And then social learning by Albert Bandura, no, we learn not only through our experience but by merely observing people. So papasok dyan ng modeling or also known as observational learning. No, this is very important, no, kasi yung concept of probability of learning, information processing, and attention have become increasingly important in psychopathology. Yun, yung nakikita natin sa environment. No, let's say for example, number 1 dito ang violence. No, kung halimbawa ito ang madalas makita ng bata, so akala nila tama siya. So nagbabago ang behavior, no, nagiging aggressive sila. Prepared learning, yung evolutionary basis, no, so parang why do we so readily learn to fear snake or spider? No, so one probability is this was passed on by our ancestors. So yung tinatawag natin evolutionary basis. So pero still, it increases survival. No, kasi halimbawa nagkakaroon ng one trial learning, no, yung first time na mong matutunan, ang tendency, alam mo na siya the next time. No? Kung halimbawa napaso ka the next time alam mo na siya. So it increases survival. Emotions, no, the basic emotions of fear, anger, sadness, or distress and excitement may contribute to many psychological disorders and may define them. No, so emotion has 3 important and overlapping components: yung behavior, cognition, and physiology. Once a person is experiencing an intense emotion, it can affect our behavior, no, even cognition and even physiology. Now, what is the difference between mood and affect? Now, when we say mood, more persistent. no? So just remember yung M star, it refers to emotion, no? Yung mood, emotion. Yung affect, F, facial expression. Kaya ang sinasabing affect is momentary emotional tone. Ang mood is more persistent kasi if you're happy, no, pwedeng you feel happy for 1 year o kaya for a month, no? Pero so, syempre hindi ka naman nakangiti ng 1 year o kaya 1 month. No? So pwedeng quiet ka lang, no, pero you feel happy. Kaya ang mood is more persistent, ang affect naman is momentary emotional tone. Yan. Cultural, social, and interpersonal factors. No? So this influence form and expression of behavior. No? Example, mga religious practices, no? O kaya mga child rearing. No? This is also one factor to consider, no? In studying human behavior or even psychopathology. No? Let's say, bakit ba ang mga Jewish children mas individual sila and they're very independent kasi sa Jewish family pala they support or they encourage the kids to assert, no? So yan hindi pwede yan sa Philippines, di ba? So otherwise nako ano tayo, masasabunutan tayo. So bakit ba ang mga Jewish children talagang they experience less fear, no, compared sa iba kasi sa kanila supported, no? Talagang sinusupport nila yung you stand out, no, you assert yourself, no, compared in other countries. Compared naman sa Bedouin children, no, ito talagang they inculcate yung importance ng group at saka ng family. No? Whenever you make decisions, kailangan you consider everybody. Kaya ang tendency, they are more fearful than Jewish. No? Kasi ito kailangan kinoconsult pa sa family. No? Ang mga Jewish kasi very independent sila. Ang gender, this is also one factor, gender roles. No? Have a strong and sometimes puzzling effect on psychopathology. No? So gender effect and roles related to cultural imperatives, no, influence across several dimensions. Bakit ba pagka, let's say, umiiyak, hindi pwede sa lalaki, bakit dapat pambabae lang? When it comes to occupation, bakit kini-question kapag ang preferred ng babae ay panlalaki and vice versa? Even coping strategies, di ba? Bakit ba based on culture, mas mabilis mag-cope ang babae kaysa sa lalaki kasi ang babae mayroong tendency to be friendly kaya they tend to vent out their concerns whereas ang male daw they resort to use of alcohol and drugs. So papasok dito this gender roles is also one factor to consider in the study of psychopathology. Papasok din dyan yung expectations ng society. Now, the social effects on health and behavior, no, yung frequency and quality are critical. No, the longer you are likely to live, no, facilitate healthy promoting behaviors. No, let's say sleep better, less alcohol, o kaya pag we have many friends, o kaya close relationship ka with the family, usually it's a contributory factor to a healthy lifestyle. No? So pag low social contacts mo, usually it causes higher mortality, higher psychopathology, and lower life expectancy. Pag mediated by meaning and perception, ito yung mga may reason to live for, no, yung meaning to life. Pero based on research, this is not conclusive kasi there are also some who live alone, no, but they're very happy. No, may mga ganyan, kanya-kanya din naman. O kaya may iba naman na ang daming kaibigan o kaya close sa family pero they feel sad and they also feel lonely. No, ayan. Pero very common among elderly, no, talagang if let's say their partner dies, 'di ba, ang tendency isa susunod na din. And then may iba naman ang ginagawa nilang coping, no, they adopt a pet, no, kaya talagang they live with their family. Tapos social and interpersonal influences on the elderly, no, the effect of social, interpersonal factor on the expression of physical, psychological disorder, no, may differ with age. No, so 'di ba kapag ka medyo elderly, no, mas mataas ang rate ng depression, no, mas mataas ang rate ng committing suicide, no, kasi wala na nga silang support system. So this another one is the stigma of psychopathology. No, it influences the expression of distress, limits help-seeking behavior, and helps maintain the cycle of pathology. No, pag when you say stigma, ito yung may worry yung mga tao na magpa-check up kasi baka mapagtawanan. Excuse me. Kaya ang tendency, wag na lang, no? It limits. Tapos lalo lang tuloy-tuloy lang yung cycle of pathology kasi they do not seek a professional help. So baka mapagtawanan, they will be laughed at, no, mocked or bullied. The global incidence of psychological disorders are common across cultures, are accounting for 13% of the global burden of the disease. Now, the race and expression varies. The prevalence and the incidence influenced by poverty, no, political unrest, no, yan, sa government yan, technological disparities. No, I think ito medyo na-stress tayo nung nag-lockdown. And then treatment depends on views and provider availability. So still factor dito ang culture kasi may iba would resort to seeking help from albularios, 'di ba? Mga prayers, no, pero may iba naman more on medicine naman, no, may mga ganyan. So depende din ito sa availability ng mental health practitioners, no. So ilan ba ang mga psychologists na available? Let's say in the province in Manila, actually based on statistics, mas marami ang psychologists sa Manila, no. Nandito lahat tayo, no. Konti lang sa provinces na sana doon mas marami. Then lifespan developmental, no, change over time, no. So this refers to biological maturation, no, yung psychosocial development, no, social complexity, the roles and the demands, no, expression of disorders and treatment response. So dito papasok yung the end of history illusion, no. Pag sinabing end of history illusion, yung cognitive bias that makes us think that we will change very little in the years to come. So akala natin hindi na pwede, no, pero pwede magbago. So to understand psychopathology, no, we must appreciate how experiences during different periods of development may influence our vulnerability to other types of stress or to different psychological disorders. And then yung principle of equifinality proposed by Cicchetti in 1991, ang sinasabi ng principle of equifinality is that several paths, no, to a given outcome, no, hindi pwedeng ito rin papasok yung multidimensional, pwedeng maraming paths, no, para ma-develop yung psychological disorder. No, let's say for example ang delirium, 'di ba, ang older adults very common ito, no, pero pwede din ma-experience ng iba, no. Let's say for example after surgery, pwede, o kaya pwedeng kidney disease, no, pwede din actually ito, o kaya ang autism, one example. Ang sinasabi dito, pwedeng factor na ang mother daw exposed to rubella during pregnancy, no, pero pwede din ma-experience nito kapag merong difficulty during labor. Or pwedeng nasa genes, no, yan. Ano siya, paths vary by developmental stage. And then yung the paths can be in the form by yung interaction with other dimensions, yung social support. And then this is another one, no, nice to know din ito, yung gut bacteria and the brain, no. So there's a mounting evidence that the composition of bacteria species in the gut is also linked to changes in the brain structure and how it functions. So scientists think the metabolites produced by the gut bacteria enter the blood and can cause inflammation, contributing to brain diseases such as Parkinson's, Alzheimer's, and autism. So factor din yung nasa gut natin. No, so yung people with mental illnesses such as depression, anxiety, and schizophrenia have all been shown to have dramatically different gut bacteria to those found in healthy gut. So factor dito yung sa gut kasi sa gut daw natin merong good at saka bad bacteria. No, kaya pag continuous ang pagkain ng unhealthy food, ang masaya dyan yung bad bacteria. So pag tuloy-tuloy yan, no, magkakaroon na ng sakit. No? So physically, no, ayan yung diabetes, hypertension, pero based on research, factor na din dito ang mga psych disorders, even schizophrenia, yan, no, even depression. So nasa kinakain daw natin. Pero pag kinakain natin yung healthy foods, ang masaya dyan ay yung healthy bacteria. No, pwede pa rin daw kumain ng unhealthy foods, pero dapat madalang lang. So dapat mas dominant ang good bacteria compared sa bad bacteria. Yeah, this is just nice to know, no, just in case na ano lang, factor ito sa biological perspective yan eh. And then I think nawala sa PowerPoint yung sinasabi ko na predisposing at saka precipitating and perpetuating. Now, when we say predisposing factor, this is a condition that came before and paved the way for a possible later occurrence of the disorder under certain conditions. So pag sinabing predisposed, you are a candidate. No, example, genes. O kaya nasa age, no, very common dito elderly, o kaya even adolescents. Gender, no, pwedeng occupation, let's say exposed sa chemical, so talagang candidate yan. And then yung precipitating factor, it triggers the disorder, no? Condition that proves too much for the individual. Example nito let's say environmental and social factors, o kaya exposed to alcohol, experience trauma, or even family member separation. Yan, na-trigger yung disorder niya. Yung predisposing factor, predispose yung tao, candidate siya. No, so pinaka tatandaan na lang diyan yung genes, no, candidate yan talaga. Ang precipitating factor na trigger kasi expose siya sa isang traumatic o kaya very stressful environment. Ang perpetuating factor naman, these are causing an existing psychiatric disorder to continue. No, pag sinabing perpetuating factor, because of the disorder, na lagi lang siyang ganon, no, walang improvement. Example, di ba, a person diagnosed with depression was a tendency, merong social withdrawal, merong anhedonia. So nagkukulong lang siya sa kwarto. So walang improvement, hindi gumagaling kasi nga lagi nakakulong sa kwarto or ayaw makipag-usap. So that is considered as the perpetuating factor. Yan. Yeah, any questions before we proceed to the next? Would you like to have a break? 10 minutes? It's 10:05 sa akin. 10:15. Okay. Sige, 10:15, we go back, then proceed. Okay, hello. Good morning ulit. So let's resume. Very fast, let's just review this assessment. No, so how and why does the client behave abnormally? So yung assessment and diagnosis, of course, this has to be conducted, assessment must be conducted thoroughly. Now, when we say thoroughly, dapat na-exhaust lahat ng possible means. And of course, pag tama lahat ng assessment, we will be able to come up with the correct diagnosis. And pag tama ang diagnosis, no, tama ang intervention. So a brief history of assessment, it all started among the Babylonians. So astrology yung kanila, no, they made use o kaya they relied on the movements of the stars, the planets, no, to identify kung magkakaroon ba ng famine o kaya changes in their life. Tapos among the Greeks, no, particularly Pythagoras, no, introduced physiognomy. This is measuring the facial features, no, most likely sa kanya natin nanggaling yung belief na kapag malapad ang noo, no, kapag maikli ang tenga, o kaya pag malaki ang tenga. And then of course, it was the Chinese people who had the first written assessment procedure. So talagang sa kanila nagsimula ang paper pencil test, and then even the battery test, no, that they administered to people who wanted to be part of the yung military service. Actually, even yung mga kasambahay, no, binibigyan din nila ng tests. So ito yung start na ito yung naging inspiration, no, ng Americans, ng mga British, no. That's why they were able to come up with different psychological tests na. And then when we say clinical assessment, this is the systematic evaluation and measurement of psychological, biological, and social factors in an individual presenting with a possible psychological disorder. So what's the goal of assessment, or what's the purpose? Number one is understand the individual, predict behavior, treatment planning, and even evaluating outcomes. So parang funnel analogy yan, no? Kapag let's say we are presented with a problem, so based if you know yung funnel na material, so broad muna, multidimensional start hanggang sa it narrows to a specific problem. So key concepts in assessment, yung reliability, the degree to which a measurement is consistent. Number two, the validity, the degree to which technique measures what it is designed to measure. Number three, standardization, application of certain standards to ensure consistency across different measurements. So reliability refers to the consistency of a test. A good test will always yield the same results in the same situation. There are two main types. Yung test, retest reliability yields the same results every time it is given to the same people. Inter-rater reliability naman, different judges independently agree on how to score and interpret a particular test. Ang validity refers to the accuracy of a test results. A good test must accurately measure what it is supposed to measure. So kung gusto mong i-measure ang IQ, dapat yung questions mo pang measurement ng IQ, no? Kaya kung personality yan. Three specific types, no, face validity, a test appears to measure what is supposed to measure, does not necessarily indicate true validity. Pag sinabi kasing face validity, yung kita pa lang sa sa test material, talagang psych test ito. No, kumbaga ang face validity refers to the face value. No, and then yung predictive validity, no, a test accurately predicts future characteristics of our behavior. So let's say for example, lahat ng pumasa sa entrance exam, magtatap ng board exam. No, predictive yung test na yan. So ibig sabihin pag nangyari yon, very good siya, no, valid ang test na ito. Ang concurrent validity naman is a test that results agree with independent measures assessing similar characteristics or behavior. So when we say concurrent validity, let's say you have two instrument, no, kapag let's say pareho ang nito ang nag-yield ng result, so ibig sabihin yung both test na to is valid. Standardized or standardization, consistent use of techniques, no, provides normative population data. No, examples ng standardization is the administration procedures, no, yung scoring, evaluation of data. No, what are the methods of assessment? Number one is the clinical interview, the core of most clinical work. Of course, what's the purpose? You gather information about the current, the past, no, behavior, attitudes, and emotions, the detailed history. This includes the person's life, presenting problem, the current and past interpersonal and social history, family makeup, individuals' upbringing, sexual development, religious attitudes, relevant cultural concerns, and educational history. What are the characteristics and purposes of a clinical interview? It's an interaction. It's an art, no more than a science. No, kasi pag sinabing art, you should know when to ask questions. You should also know when not to ask questions. So talagang dapat ano ka dyan, skilled ka, no, para ma-elicit mo lahat ng information from the patient or from the client. Setting, of course, very important. Dapat conducive for interview, no, free from noise, no, dapat confidential, free from distractions. No, for rapport, this involves a comfortable atmosphere and a mutual understanding of the purposes of the interview. When we say rapport, this is not a state, no, wherein the therapist is always liked or always regarded as a great person. Hindi naman porke nagtawanan na kayo sa mga jokes ninyo, talagang may rapport na. Kailan masasabing may rapport? This is a relationship founded upon respect, no, mutual confidence, trust, and a certain degree of permissiveness. Kapag kasi client naniniwala sa iyo at sumusunod na, no, sa treatment plan mo, most likely meron ng rapport. Yeah, so kumbaga may trust na and confidence. Kaya lang ang rapport class, very difficult din ito kapag difficult to develop if the patient is let's say pumunta sa'yo because of compliance lang, o kaya pumunta sa'yo dahil kailangan for, let's say, for employment. Kaya mahirap no, minsan mahirap talaga. Pangatlo, pagka-family ang involved. So mahirap ikunin ang rapport ng lahat ng members. Number 5, communication, no, verbal. Of course, this involves verbal and non-verbal. Pag sinabing verbal, you make use of words. Pag sinabing non-verbal, you make use of symbols, gestures, no, paralanguage, facial expressions, and body posture, no, language, even silence and listening. Tapos the impact of the interviewer, yung impact mo sa client, no, how are you seen? No, do you exude positivity o kaya ano pa? Pwedeng negative, no? Baka medyo mataray ang dating. So this can also affect the interview session. Use of questions. This is also very important. When we say open-ended, gives patient the responsibility and latitude for responding. Talagang we allow the patient to explore and talk about anything. Pag sinabing facilitative, encourages patient's flow of conversation. No? Yung, can you please tell me more? Yan, facilitative yan . Please go on. No, tuloy ka lang. Yan, facilitative. Clarifying encourages clarity or amplification. No, pwedeng you clarify kasi medyo hindi mo narinig ng malinaw, o kaya you clarify because very vague yung term na ginamit niya. No, example, gusto ko nang mawala . O anong ibig mong sabihin sa sinabi mong gusto mo nang mawala? No, you clarify. Ang confronting at saka direct questions, usually this is used kapag meron ng rapport kasi the client might be offended. No, kasi pag nagko-confront ka, you challenge inconsistencies or contradictions. No, pwedeng halimbawang ayaw kong uma-attend ng party kasi na-anxious ako. No, pero the next session, nabanggit niya sa'yo na umattend siya ng party at nag-enjoy siya. So, inconsistent. So, you confront, no? Teka lang, sabi mo noon ganito, bakit ngayon bigla? Ang direct naman, no, so direct questions ito, no, usually this involves mga personal issues na, no, so talagang diretso mo nang itatanong sa kanya. Pero very important, confronting and direct must be asked kapag ka meron ng rapport. Pero use of questions, by policy, we do as much as possible, we avoid asking why questions, kasi this is a veiled criticism. No, in some way, we are requiring our client to justify their decisions and behavior. So it's a no-no. Talagang ang pinaka-recommended is the open-ended question. And then conducting the interview can be either unstructured or semi-structured. No? In unstructured interview, clinicians ask open-ended questions. Pag semi-structured or structured, meron ng prepared questions, often from a published interview schedule. So this actually may also include the mental status exam. Merong advantages and disadvantages ang unstructured and semi. No? Pag unstructured, pwedeng mawala sa topic o kaya you will kakain ng maraming oras. Pero ang semi-structure, dahil ready na yung questions, no, nakafocus ka sa gusto mong malaman, yun lang parang robot, no, ang conversation kasi you will just simply tick the box. Now, sa interview, this may also include the MSE. No, MSE is an analogous to physical examination in physical medicine. It provides a format for the systematic observation and recording of information about a person's thinking, no, emotions, and behavior. So what is an MSE is not, this is not an intelligence test. This is also not a detailed memory test, also not a fully precise measure of cognition, affect, and behavior. Why do we administer MSE? No, this is just to simply check, no, baka possible lang, no, na possible na candidate yung client for psychological disorder. So after the MSE, of course, we also conduct a thorough assessment. So factors to be considered when we administer MSE, no, we have to consider the social, the cultural, and the educational. No, kaya naman pala walang eye contact kasi sa kanilang kultura, hindi nila practice yun. O kaya pala hindi masagot yung question mo na trigonometry. No? So of course, we do not ask that in MSE kasi yung tinapos niya ay grade 1. O kaya you always speak in English, no, pero ang prefer pala niya ay Tagalog. So kailangan kino-consider yan. So it's not fair, no, kapag sa report hindi okay ang pasyente, yung pala we did not consider yung mga kanyang culture, no, educational and social factors. So again, these are the outline, no, for the MSE. We check for the appearance and the behavior, no, yung hygiene and grooming, appropriate dress, no, posture, the eye contact, facial expression, even gait, no, yung GAIT, no, paano ba siya maglakad. We also check for the unusual movements or mannerisms, yung psychomotor retardation, mabagal, tapos yung waxy flexibility, hindi naman gumagalaw. Thought processes, no, how client express themselves, no, this constitutes the how of client thinking, no, paano ba siya mag-isip, no, yung malalaman natin ito kung kakausapin natin siya, no, yung rate of flow speech, mabagal ba o mabilis, loss of association, no, flow of thought in which ideas shift from one subject to another in a completely unrelated way, no, nag-jump siya from one topic to another, or hindi align, no, yung kanyang yung sinasabi niya o yung sinasagot niya sa tanong mo. Flight of ideas, nagbabago. Rapid continuous verbalization or plays in words, producing constant shifting from one idea to another. Ideas tend to be connected and unless severe from a listener may be able to follow them. And then neologism, creation of new words, no, sila lang ang nakakaintindi niyan. No, so hindi mo siya naintindihan pero siya, para sa kanya may ibig sabihin yan. Circumstantiality, I think one example ng neologism, yung Jejemon. Ewan ko kung naabutan niyo pa yon. No, ang hirap-hirap ng intindihin, pero yung generation noon, sila yan, ginagamit nila. Circumstantiality, nagtanong ka, ang daming sinabi, pero nasagot naman niya. Ang tangentiality, nagtanong ka, ang daming sinabi, pero hindi niya nasagot. So ito lang tinatandaan ko dyan sa tangentiality, yung tangi, no? So para hindi na makalimutan at malito. Yung tangentiality, ito tangi, no, hindi niya nasagot yung tanong mo. Ang dami-dami niyang sinabi pero hindi niya nasagot. Pero ang circumstantiality, nasagot naman niya kahit marami siyang sinabi. Perseveration, persisting response to a previous stimulus after a new stimulus has been presented, often associated with cognitive disorders. Pag sinabing perseveration, nagpe-persevere yung sagot niya, yung stimulus, no? Kahit iba-iba na yung tanong mo. Let's say for example, kamusta ka? Okay naman ako, uuwi ako bukas. Anong gagawin mo mamaya? Magkakain, pero uuwi ako bukas. So yung sagot na uuwi ako bukas laging nandoon. So kahit bago na yung mga questions. So perseveration ang tawag doon. Of course, echolalia, letter L, no, ginagaya yung sinasabi. Clang association, rhyming ang words, parang nagre-rap yan. Blocking, no, ito yung pag sinabing blocking, biglang tumigil siya. No, pero there are many factors to consider kasi pwedeng nagpapahinga lang o kaya wala na talaga siyang maalala or pwedeng na-distract siya. No, pero minsan may mga blocking is also known as thought deprivation. Pero usually ang nangyayari pag may blocking, patients tend to confabulate. No, nagko-confabulate sila, ibig sabihin gumagawa ng storya, no, para lang to fill in the story. No, pagka ganito, we just simply take note and then we do not call their attention, no, parang iba na yung kinikwento mo. No, pagka ganito, ano na yan, talagang may problema, no? And then thought content refers to specific meaning expressed in client communication. So ito yung delusion of persecution, no, delusion of grandeur, delusion of reference, tapos delusion of alien control, sorry for the T, tapos yung mga perceptual disturbances niya, no, let's say hallucination, no, merong auditory, visual, olfactory, tactile, and gustatory, pero very common dito sa hallucinations and auditory, followed by visual. Ang auditory, very common among schizo, ang visual naman, very common among alcoholics. Of course, when we conduct MSE, we do not ask, no, meron ka bang hallucination or meron ka bang delusion. While conducting the interview, malalaman naman siya kaagad, no? So yung kanyang thought content yan. Even yung kanyang physical appearance, no, we do not of course check, obviously, no, subtle way lang yan. No, habang kausap mo siya, chine-check mo na yung damit niya, o habang naglalakad siya papunta sa'yo, chine-check mo yung paglakad niya. So dun ka nag-take down notes. Obsessions, no, we can also take note of this. No, these are recurrent and persistent ideas, thoughts, and images. So commonly, obsessive-compulsive clients wonder. So ito, pagka kausap si patient, pwedeng malaman kung meron siyang obsessions or compulsions. Ayan, no, are my hands clean? Have I been contaminated? Did I remember to lock the front door? No, did I remember to turn off the oven? No, is anyone under my bed? Kung sakaling merong OCD si patient, of course, our consideration is to allow them, no? Hindi pwedeng sabihin na mamaya mo na gawin kasi nag-i-interview pa ako sa'yo. Kailangan tatapusin, hayaan siyang tapusin. Kung 20 times siya maghugas ng kamay, hayaan na 20 times. Kasi it will only worsen her feelings of anxiety, tapos hindi rin siya magko-cooperate sa'yo. Mood and affect, we check. Of course, as mentioned earlier, when we say mood, this refers to emotion. Affect, this refers to outward expression, your facial expression. So these are the common terms in assessing affect. No, yung appropriate affect, of course, yung normal. No, inappropriate, yung may disharmony. Tapos yung blunt affect, severe reduction in the intensity of externalizing feeling tone. Di ba pagka blunt knife, mabagal mag-cut ng meat, example, o kaya ng bread, kasi blunt siya, purol. Ganon din sa blunt affect. Ang tagal, no? Pwede siyang ngumiti, kaya lang ang tagal ng kanyang reaction, no? Blunt affect yan. Flat affect naman, zero. No, absence or near absence of any signs of affective expression. Talagang wala kang makikita. Very common among people with schizophrenia, no, pero can you take note, just because na meron silang flat affect doesn't mean that they do not experience emotions. Meron. They also experience sadness, frustration, happiness, joy, etc. Kaya lang they have difficulty expressing it. No, so ganyan sa schizo yan. Restricted affect or constricted, may reduction, no, in intensity of feeling tone, less severe than blunted affect. When we say restricted, no, imbis na maging mas masaya, masaya lang siya, no, restricted siya. So ang mood, no, very common ang labile, no, oscillations in mood between euphoria and depression or anxiety, paiba-iba. Label indifference, inappropriate attitude of calm or lack of concern about one's disability, no, walang pakialam sa kanyang state, kanyang status. Anhedonia, loss of interest. Depression is a psychopathological feelings of sadness. Hyponomia, lesser ito compared sa mania. No, mania is characterized by elation, agitation, hyperactivity, hypersexuality, and accelerated thinking and speaking. Yung hyponomia, ito yung lesser. No, ito yung opposite ng mania. Intellectual functioning, we check for the memory, no, recent memory, yeah, what is my name, remote memory, where and when did you get married, immediate, no, I will ask you to remember 3 words and I will ask you to repeat them to me in 5 minutes. We can also check the information and the vocabulary, no, name the last 5 presidents, o kaya name the current presidents, o kaya name presidents of a certain country. So you can, baka kaya naman, malaman niya sino ang current president ng America, ng Philippines, or other countries. Abstractions, similarities, no? Anong pagkakatulad ng apple at saka ng orange? Proverb, you can check yung concrete at saka abstract. Ito, let's say for example, you should not cry over spilt milk. Kapag ka malalim ang kanyang interpretation, good ang kanyang abstract thinking, no? So wag nang balikan ang nakaraan. Ayan, abstract thinking 'yan. Pero kapag literal ang kanyang interpretation, concrete thinking, no? Wag kang iiyak kapag natapon ang gatas mo, concrete 'yan. So very good of course kapag abstract thinking kasi malalim mag-isip, no? Very metaphoric. Ability to concentrate, no? So you can ask the patient to spell backwards o kaya do some calculations, mga simple mathematics lang naman yan. Sensorium, no, this refers to general awareness of one's surroundings, oriented times 3 to person, place, and time. So ito yung tinitingnan. No, pangalan, o kaya sino ako, o anong pangalan mo ulit, nasaan tayo ngayon, at saka anong oras. Judgment, ability to interpret one's environment and situation. You can provide hypothetical situations. No, anong gagawin kapag nasusunog ang bahay? Ayan. Pagka nasagot niya ng tama, no, good judgment. Kapag hindi, poor judgment. Insight, ability to understand the true nature of one situation. No, pagka naintindihan ng pasyente bakit siya nasa mental hospital, good insight. Kapag alam niyang nagbabakasyon lang siya doon, poor insight. So these are the other methods, yung psych testing, projective test, mainly used by psychodynamic practitioners. Na ito yung kanilang favorite kasi through drawings, na ilalabas mo yung nasa unconscious level of awareness mo. So very popular sa projective ang Rorschach, thematic, sentence completion, at saka drawings. So this is an example of a thematic apperception test. So cards will be shown to the patient, tapos dapat may story siya na sasabihin to identify their needs and current concerns. Ang Rorschach, ito din, no, mga ink dots ito. No? So this is shown to the patient, then asked to interpret kapag realistic ang kanilang mga sagot, so may mga plus points yan. No? Pagka negative, no, unrealistic siya, negative. So ang Rorschach, I think very difficult to administer. Ang sentence completion, of course, you complete a sentence to identify din mga concerns and needs. Drawings, no, very well known ang draw a person test, even the house tree person. Tapos may kinetic pa, no, kinetic family drawing test. Personality inventories, no, pinaka number 1 na ginagamit ang MMPI, no, in the clinical field. No, we have the MMPI original or the MMPI 2. Then for adolescents, we have the MMPI-A. Consists of 550 self-statements that can be answered true, false, or cannot say. So statements describe physical concerns, no, mood, moral, attitudes toward religion, sex and social activities, and psychological symptoms. Assesses careless responding and lying. So ito yung 10 clinical scales. Tapos scores range from 0 to 100. Kapag above 70, deviant yan. Tapos we need to graph, no, to create a profile. I'm sure when you were in college, you answered MMPI. No, and then we have IQ test, no, designed to indirectly measure intellectual ability. So this is also administered even in the clinical setting, no, to identify kung ano ba yung kanyang intellectual ability, no, para pag gumawa ng treatment plan according sa intellect niya. So typically comprised of a series of tests assessing both verbal and non-verbal. So the general score is an intelligence quotient, very popular ang Wechsler, at saka yung itong Wechsler Intelligence Scale for Kids, even SPIS. Neurological and neuropsychological testing. This is to assess brain functioning, no, by assessing brain structure and activity. So ito yung mga machines na kailangan dyan. No, yung EEG, the PET scan, the CAT, and the MRI. So neuropsychological test indirectly assess brain function by assessing cognitive, perceptual, and motor functioning. So most widely used is the Bender Visual Motor Gestalt test. Psychophysiological test measures physiological response as an indication of psychological problems. This includes heart rate, blood pressure, body temperature, the galvanic skin response, and muscle contraction. Very popular ang polygraph. Behavioral assessment, we conduct naturalistic observations in school, homes, institutions, and community settings. So very focused on parent-child, sibling-child, or teacher-child interaction. So observations are generally made by participant observers and reported to a clinician. So pwede din ito kasama yung observers as the participant. Part din ng observation is self-monitoring. People observe themselves and carefully record the frequency of certain behaviors, feelings, or cognitions as they occur over time. Yan. So ito yung, and then physical examination. Of course, it's conducted by medical doctors with the nurses, no, to diagnose or rule out physical etiologies, no, kung merong toxicities, medication side effects, no, allergic reactions, even metabolic conditions. Diagnosis, no, the person's problem is classified within one of a set of recognized categories of abnormal behavior and labeled accordingly. So classification of abnormal behavior started with Hippocrates, no, who labeled mania, melancholy, and phrenitis. Emil Kraepelin furnished psychiatry with its first comprehensive classification system, again based on medical model, di ba? Ginaya niya kung paano ginagawa sa sa physical diseases. Ganon din ang ginawa niya sa psych. And then APA, no, yung DSM, APA published the DSM, no, yung Diagnostic and Statistical Manual of Mental Disorders. So DSM classifies mental disorders into categories. It describes each disorder and provides diagnostic criteria to distinguish one from another. So has undergone multiple revisions to increase reliability and validity, and the current version is DSM-5-TR. I'm sure you have encountered ICD. No, yung ICD na kung na-check niyo yung DSM niyo, nandun yung ICD, yung international classification. Tapos yung DSM-5, ano bang difference ng dalawa? Kasi worldwide, ang ginagamit talaga yung ICD. Yun din ang basis kasi ng mga health insurance. No, of course, ang DSM-5 naman, ginawa ito ng mga mental health practitioners. No, symptoms for each diagnosis are clearly listed. Number of symptoms necessary to receive diagnosis is specified. So assumptions about causes not included. Now focus only on observable behavior. So it all started in DSM-1, published in 1952, contained a glossary of descriptions of the diagnostic criteria. It reflected Adolf Mayer's influence on American psychiatry and classified mental disorders as various reactions to stressors. So yung DSM-1, manipis lang talaga siya. Tapos ang basis nito, it's more on theory. No, na yung nangyayari sa pasyente, reaction lang niya yun sa stressors. So this is one example of the table of contents, no, para you have an idea, say manic depressive reaction, manic type, no, kaya may manic depression kasi reaction niya yan sa kanyang stressors. Ang DSM-2 published in 1962, similar to DSM-1, but it dropped the reaction concept but maintained a perspective strongly influenced by psychodynamic theory. So again, yung DSM-2, naka-base pa din siya sa theory. No? And then another publication in 1975 wherein homosexuality was removed from the list of sexual disorders. So ang the best na DSM, nag-start siya sa DSM-3. Now, this was published in 1980 kasi naka-base na siya sa research. No? Research-based na to, empirical and phenomenological approach to diagnosis. So talagang pinag-aralan nila compared sa DSM-1 and 2 na based lang siya sa theories. So nagkaroon dito ng multi-issue classification system. No, the same din sa DSM-4, no, na bago lang ng konti. I'm sorry. So yung axis 1 sa DSM-3, schizophrenia lang, pero sa DSM-4 all na, no, kasama na lahat diyan. Axis 2, dito personality disorder specific to developmental problems, pero sa 4 naman, personality disorders and mental retardation. Ang axis 3, the same. No? This refers to medical, physical disorder. Axis 4, severity of psychosocial factors. Axis 5, the highest level of functioning during the previous year. So dito sa, depende sa diagnosis ng clinician, ilalagay niya yan sa axis-axis. No, pag axis 1, dito na siya sa DSM-4. Kung halimbawa may depression, ilalagay sa axis 1. Kung mayroong personality disorder or mental retardation, ilalagay sa axis 2. Pag general medical conditions, let's say may sakit siya, no, mayroong hypothyroidism, o kaya meron siyang skin diseases or allergy, ilalagay sa axis 3. Kung halimbawang meron siyang problem when it comes to family, ilalagay sa axis 4. Ang GAF scoring ito, no, upon admission, during, at saka after. No, pero sa DSM-5, tinanggal na itong multi-axial classification system. Isang diagnosis na lang siya. And then, isasama na lang sa report kung meron pang other contributory factors. So yung specific diagnostic criteria, this involves the essential features, no, those that define it, no, yung criteria, yung diagnosis. Associated features, those that are usually present. Tapos diagnostic criteria, a list of symptoms that must be present for the patient to be given this diagnostic label. And then number 4 is the information on differential diagnosis. No, so dito sa number 4, very good ito kasi you get to identify, no, ano ba talaga ang disorder na ito compared sa isang disorder kasi nag-overlap ang signs and symptoms. So this is one example. I'm sure you have seen one. So that's the end of the assessment. So let's proceed to anxiety disorders. Okay. So let's discuss anxiety disorders. Which part of our brain is responsible for processing fearful and threatening stimuli? Okay, responsible for fight or flight response, and even memory. This part of the brain is known as the amygdala. No? So amygdala ang nagfa-function sa ating anxiety disorders. So anxiety disorder, this include disorders that share features of excessive fear and anxiety and related behavior disturbances. What is anxiety? This is a negative mood state characterized by bodily symptoms of physical tension and by apprehension about the future. Now, there are three basic components of anxiety: subjective reports, behavioral responses, and physiological responses. Now, pag sinabing subjective reports, of course, reports coming from the patient himself. Pag sinabi niya nangangamba ako, then subjective reports yan. Behavioral responses, pagka agitated siya, lakad ng lakad, tapos hindi makagawa ng desisyon. Physiological, of course, mayroong palpitations, no, sweating, yan. O kaya increased heart rate. So those refers to physiological responses. What is the difference between fear and anxiety? Pag sinabi nating fear, meron tong action, no? Kasi meron kang nandiyan yung object, no? The feared object is known compared sa anxiety. Kaya sa fear, merong fight or flight response. Pero sa anxiety, wala because unknown ang stimulus. No, bakit ka ba balisa? No, bakit ka ba nangangamba? Hindi mo alam ang reason. Kapag sa fear, let's say takot ka sa aso, ang tendency, iiwas ka. No, o kaya takot sa prof, 'di ba? Nagda-drop 'yan o kaya magpapapalit ng schedule. Merong action ang fear, pero ang anxiety wala. Kaya minsan mas madalas na mas problemado kapag may anxiety kasi we cannot identify. Now, what happens if your experience, no, to the alarm response of fear when there is nothing to be afraid of, no? So, of course, if you have false alarm, so this suddenly overwhelming reaction, no, came to be known as the panic attack. Nandun sa isa yan, yung panic attack. Ito, no? This is defined as an abrupt experience of intense fear or acute discomfort accompanied by physical symptoms that usually include heart palpitations, chest pain, shortness of breath, and possible dizziness. What are the two types of panic attack? Expected tsaka unexpected. Pag sinabing expected, obvious ang cues or trigger. No, very common ang expected panic attack sa may phobia, social anxiety disorder, agoraphobia kasi alam, expected siya. Pag sinabing unexpected, no obvious cue, no, hindi alam. So very common ang unexpected panic attack sa panic disorder. And then within minutes na siya, no, kasi sa DSM-4, 10 minutes, no, pero dito sa panic attack ng DSM-5, within minutes. So before we proceed, no, when we say anxiety disorders, this develop during childhood and tend to persist if not treated. Very common among females. And then the disturbance causes clinically significant distress or impairment in social, academic, occupational, or other important areas of functioning. So usually sa anxiety disorders, individuals typically overestimate the danger in situations they fear or avoid. No? The primary determination of whether the fear or anxiety is excessive or out of proportion is made by the clinician, no, taking cultural contextual factors into account. So of course, we have to consider the panic attack before we can diagnose a person with such disorder, pero very particular ang panic attack sa panic disorder. Now, before we can diagnose a person with panic disorder, dapat mayroong presence ng panic attack. However, ang panic attack is not exclusive for panic disorder. So even a person with depression can experience panic attack. Now, even a person diagnosed with schizophrenia can also experience panic attack. Now, yun lang, ito ang tinitingnan sa panic disorder. So panic attacks feature prominently within the anxiety disorder as a particular type of fear response. Now, it functions as a marker and prognostic factor for severity of diagnosis, course, and comorbidity across an array of disorders, including but not limited to the anxiety disorders. So comorbidity, now this refers to co-occurrence of two or more disorders in a single individual. Now, let's say anxiety disorders is closely related to depression, or anxiety disorders also co-occur with several physical conditions. No, comorbid o kaya co-occur, no, pareho lang ibig sabihin yan. So yung panic attack diagnostic criteria is in your DSM-5, no, pero ang diagnostic criteria to includes all the physiological changes in the body. Example, palpitations, pounding heart or accelerated heart rate, no, sweating, trembling, no, sensations or shortness of breath, feeling of choking, chest pain or discomfort, nausea or abdominal distress, feeling dizzy, unsteady, lightheaded or faint, no, chills or heat sensations, merong numbing or tingling, no, known as the paresthesias, merong ding derealization or depersonalization. When we say derealization, this refers to estrangement towards the environment. Pag depersonalization, this refers to estrangement towards oneself. Now, thus, merong fear of losing control or going crazy and fear of dying. So what are the causes of anxiety disorders? No, number one, the biological contributions inherit a tendency to be tense, no, uptight and anxious. No, so possible din na merong depleted levels of GABA. Ayan. So ang anxiety is also associated with specific brain circuits and neurotransmitters. No, laging kasama yan. So then as discussed earlier, di ba, in a genetic vulnerability, does not cause anxiety and or panic directly. No, stress or other factors in the environment can turn on these genes. No, so pagka na-inherit pa yung tendency to be tense, uptight, and anxious, tapos na-expose pa sa environment na very stressful, no, possible na makikiliti talaga yung kanyang tendency, no, to develop the signs and symptoms of the anxiety disorders. And then number two is the psychological contributions. No, pwedeng example dito, actions of parents. No, pagka, let's say, secure home base, this is one factor in the development of anxiety disorders. No, let's say, for example, ang parents talagang pinrovide sa bata lahat, talagang secure. No, kapag halimbawang absent si mommy or absent si father, no, let's say, umattend ng party o kaya may busy sa work, nagugutom ang bata, walang parents, so walang pagkain, yan na yung nagiging cause ng anxiety. No, so hindi na alam ang gagawin. Compared to a child, no, a child allowed to explore the environment, yung pwedeng madapa, na hinahayaan yan, o kaya from time to time, hinahayaan na mabuli ng kalaro. So in some way, natututo yung bata on what to do compared to a child na provided lahat. So that's also one factor in the development of anxiety disorder, yung overprotective, over-intrusive, no, parents who cleared the way for their children, no, never letting them experience any adversity. So ito, hirap sila, no, they cannot control their environment. So hindi na nila alam ang gagawin nila. Social contributions, no, stressful life events trigger our biological and psychological vulnerability to anxiety. So example niyan, marriage, divorce, separation, no, difficulties at work, school, o kaya death of a loved one, no, pressure to excel in school, no, even illness, yung mga social contributions yan. Ang environment, pwedeng another one, yung environment can also change actually, when it comes to number one, yung biological contribution. Ang environment is one factor, di ba? Remember our discussion kanina? Kasi ang environment pwedeng mabago yung brain circuits natin, pwede rin mabago yung secretions of neurotransmitters. Kung halimbawa, smoker yung tao, let's say teenager pa lang, smoker na siya, nababago yung brain circuits niya. So this is also one factor in the development of anxiety disorders, no, particularly in panic and generalized anxiety disorder. Kasi pag matakas ang exposed masyado sa nicotine, so nicotine is an addictive drug that increases somatic symptoms, no, example niya, respiration, yan, it triggers additional anxiety and panic. No, kaya factor din yon, nababago siya. And then, what are the anxiety disorders? No, these are the generalized anxiety disorder, panic disorder, and agoraphobia. specific phobia, separation anxiety disorder, social anxiety disorder, known also as the social phobia, and selective mutism. So we discussed number 1, on generalized anxiety disorder, excessive anxiety and worry occurring more days than not for at least 6 months about a number of events or activities. They have difficulty to control their worry. Pag sinabi natin generalized anxiety disorder, lahat problema niya. Also known as the free-floating anxiety. So they worry crisis to crisis, constant worrier ang mga to. They worry about minor things, mga everyday life events, lahat iniisip nila. So diagnostic criteria, for God, kindly check your DSM-5, pero ang pinaka main feature ng generalized anxiety disorder inability to control worry, tsaka meron silang muscle tension. Yan ang pinaka main feature. So yan ang hahanapin nyo kapag you are asked to diagnose. Let's say bigyan kayo ng case, tapos nakita nyo yung constant worrier, tapos experiences muscle tension, o kaya cannot sleep, cannot make decisions. Kasi ang problem sa generalized anxiety disorder, they cannot sleep. So affected yung kanilang concentration plus ability to make decisions. Ito, as mentioned, God is characterized by muscle tension, mental agitation, and susceptibility to fatigue. Kaya pag hinawakan mo ang shoulders niyan, sobrang tigas. Talagang may muscle tension sila. God for children, you only need one physical symptom, and then to diagnose a child with God. Tapos usually ang worry niyan more on academics, athletic, or social performance. Pero ang cause nito ay mga parents na talagang very demanding. Tapos yung God for adults and elderly, usually they worry about misfortune, family health, and even job responsibilities. Causes of God, autonomic restrictors. So God do not respond as strongly to stressors as individuals with anxiety disorders, in which panic is more prominent. Show less responsiveness on most physiological measures such as heart rate, blood pressure, and respiration rate. Restricted yung kanilang autonomic, kaya what's the tendency? Imbis na mag-manifest sana sa kanilang palpitations and all, sa muscle na pupunta. Kaya may muscle tension sila. Cognitive, allocate their attention to sources of threat. Masyado nilang iniisip yung worries nila. So early stressful experience when they learn that the world is dangerous and out of control. This is also one factor kapag sa bahay madalas sabihin na the world is not safe, you should not trust people. So yan na yung nagko-cause ng anxiety nila. So lahat worry. And then number 3, intense cognitive processing in the frontal lobe without accompanying images. So too much thinking, yan ang cause ng generalized anxiety disorder. So kaya ang ginagawang therapy dito imagery, ipapa-imagine sa kanila or pinapa-visualize ano ba ang worry mo para they can identify and then they can address properly. And of course, yung inherit the tendency to be uptight and tense. So panic disorder and agoraphobia in DSM-4, you can diagnose a person with panic disorder with agoraphobia or panic disorder without agoraphobia. Pero sa DSM-5, sorry, dapat 5, numerical 5 ito. If an individual's presentation meets criteria for panic disorder and agoraphobia, both diagnoses should be assigned. Pinaghiwalay na siya. Bakit pinaghiwalay? Hindi kasi lahat ng may panic disorder experience agoraphobia and vice versa. Pero kung parehong meron, ilalagay lang siya panic disorder tapos another diagnosis na agoraphobia. Pero hindi na ganito ang presentation ng gaya ng DSM-4. So hindi na siya panic disorder with agoraphobia, hindi na rin siya panic disorder without agoraphobia. And then ito, panic disorder, when an individual experiences severe, unexpected panic attacks, so they may think they're dying or otherwise losing control. What's the specifier for panic disorder? Dapat yung panic attack. So dapat talagang may panic attack, present sa kanya yan. Refers to recurrent unexpected panic attack kasi hindi nga alam. So anytime pwede siyang magpanic. So one type of unexpected panic attack is the nocturnal panic attack. Ito yung nagigising sa madaling araw tapos nagpapanik siya. So what are the other theories? By the way, ang nocturnal panic attack usually occurs more often between 1:30 a.m. and 3:30 a.m. No, kasi ito na yung palalim na yung tulog. So pag malalim na yung tulog, ang tendency you give in already, no, parang wala ka na talagang control. Doon na nag-start yung panic, nagigising bigla. So pag nagising na bigla, they are now afraid to go back to sleep. No, so nasa ano yan? Yan yung tinatawag nating delta wave, no, yung deepest stage of sleep. No, so ito na yung hindi na talaga nagigising. No? So kahit may mga sounds sa environment, mahirap na magising. Delta wave yan, deepest stage of sleep. So people with panic disorder often begin to panic, no, when they start to sink, no, into the delta sleep. So ano daw ba ang causes nito? So may mga other theories na kino-consider, baka daw possible na may nightmare and other dream-like activity, o kaya lang ang sabi hindi, no, kasi this occur only during a stage of sleep characterized by REM, no, yung rapid eye movement. Hindi pa to nasa ano wala pa yan sa deepest sleep. Kaya nagigising kasi alam na may nightmare. So pag kasi nasa delta waves or deepest stage, wala nang dreams. No, kaya naalala natin yung panaginip natin kasi wala pa tayo sa deepest stage ng sleep. Possible din daw ba kaya ang sleep apnea, no, when we say sleep apnea, breathing disorder that may feel like suffocation. No, kaya lang ito kasi, ang sleep apnea, pag nagising sila, nakakatulog din ulit, no, compared sa nocturnal panic attack. Sleep terror, no, very common among kids. No, usually, pag nagising yung bata, wala silang memories about it. No, pero ang nocturnal panic attack kasi may memory, naalala nila. No, ang isolated sleep paralysis, ito yung tinatawag na the witch is riding you. No, this occurs during the transitional state between sleep and waking, no, when a person is either falling asleep or waking up, but mostly when waking up. So ito yung tinatawag natin na nabangungot. No, ito yan. Pero of course, it depends on the culture. Kasi yung ibang sinasabi, meron daw na nakadagan na witch, no, doon sa tao, kaya hindi nakakahinga. So diagnostic criteria for panic disorder, please check your DSM-5, no, pero ang hahanapin talaga dito yung pinaka main feature present ang panic attack, tapos very common ang unexpected panic attack. So ito yung different culture to consider, no, yung susto, no, yung Latin sa Latin America, no, yung ataque de nervios sa Caribbean, Kyogyo or wind overload or Trungyo, no, very common in Cambodia or in Vietnamese. No, so itong Kyogyo tsaka yung susto, ano to, yung parang may too much wind or gas in the body, no, which may cause blood vessels to burst. No, kaya merong physiological happenings in the body pag may ano sila panic. So what's the causes of panic disorder? Same, no, inherited vulnerability to stress, no, an emergency alarm reaction. Pero pag sinabing stress, hindi lang ito negative, it can be positive as well. No, yung mga, let's say, promotion in job, no, pwede rin yan. Biglang nagpanic, no, kasi ano yan, added responsibility. No, yan, cognitively, no, misinterpretation of physical sensations, no, pwedeng akala nila nagpapanik sila, pero yung pala because of, let's say, strenuous exercise lang, no, so nami-misinterpret nila yung physical sensation. Another cause is early loss of a loved one, no, pwede din yan. And then agoraphobia. So panic disorder is actually accompanied by a closely related disorder known as agoraphobia. So when we say agoraphobia, fear and avoidance of situations in which a person feels unsafe or unable to escape to get home or to a hospital in the event of developing panic symptoms or other physical symptoms such as loss of bladder control. So agoraphobia was coined by Carl Westphal, and when and agora means the Greek marketplace. No, pagka sinabing agora, no, pwedeng this can also refer to shopping malls, no, cars, buses, basta sa labas. Ayaw nila yan. An individual who has not had a panic attack for years may still have strong agoraphobic avoidance. No, yung iba naman, how do they cope? No, they resort to the use of alcohol and drugs. Kaya what's a tendency, nagiging addicted sila. Kaya person diagnosed with agoraphobia may also be diagnosed with substance abuse. No, they do not avoid, yung iba naman, who do not avoid agoraphobic situations but endure them with intense dread. No, yung iba walang magawa, talagang kailangan lumabas, pero talagang they endure, no, hirap na hirap sila diyan. Or they require for a companion. No, kailangan nila ng kasama para pag sakaling nagpanic sila, no, may tutulong sa kanila. And then when we talk about interoceptive avoidance, this is the avoidance of internal physical sensation. Iniiwasan na nila yung mga activities na pwedeng magpanic sila o kaya magkaroon ng changes in their physiological happenings in the body. Let's say, for example, exercise, dancing, running up flight of stairs, o kaya getting involved in a heated debates, no, yan, or watching an exciting movies, no, iniiwasan yan kasi most likely pwedeng ma-trigger na naman. So diagnostic criteria for agoraphobia is in your DSM-5. So ang hahanapin naman, ang main feature talaga dito, meron silang fear, no, in going out. And then when they go out, talagang they endure it. Tapos may mga physiological happenings inside the body. Next one, we move on to specific phobia. Ang specific phobia in DSM-3, no, this used to be known as the simple phobia. No, kaya lang pinalitan ito sa DSM-4 ng specific phobia kasi ang sinasabi, hindi naman siya simple. No? Pag kaya nga sinabing may phobia, talagang may problema. So they remove simple phobia and change it to specific phobia. And then this is characterized, it is an irrational fear of a specific object or situation that markedly interferes with the individual's ability to function. And then yung active avoidance, no, of course, dahil alam nila kung ano yung magkukos ng stress nila, merong active avoidance, no? It means the individual intentionally behaves in ways that are designed to prevent or minimize contact with phobic objects or situations. So what are the factors, no, following a traumatic event talaga ito? Nagkaroon ng trauma, no, kaya nagkaroon ng phobia. Diagnostic criteria for specific phobia, no, it's in your DSM-5. I hope you have a copy of the DSM-5. No, kung wala, siguro I can give one soft copy kay sir. So we have different types of specific phobia, no, yung blood injection injury phobia. Ito yung nahihimatay at the site of a blood o kaya yung may injection. So bakit nahihimatay? Again, yung inherited vasovagal response, bumababa, no? There's a decreased heart rate and blood pressure kaya nahihimatay. And then number 2, yung situational phobia, there's a fear of specific situations. Now, let's say takot sa transportation or takot sa small places. Natural environmental phobia of heights, no, storms, water, no, may cluster together, associated with real dangers. Animal phobia, no, dogs, snakes, and mice, no, may be associated with real dangers. Tapos others, no, may phobic avoidance of situations that may lead to choking, vomiting, or contracting an illness, or in children, avoidance of loud sounds or costume characters. An individual who becomes anxious only occasionally, upon being confronted with a situation or object, becomes anxious when flying only on 1 out of every 5 airplane flights, would not be diagnosed with specific phobia. So dapat consistent siya. So we have to consider the sociocultural. Pagka mayroong fear of the dark may be reasonable in a context of ongoing violence. So it is common for individuals to have multiple specific phobia. So ito, yung culture-bound syndrome, one example is Pale, yung sa China. Meron silang phobia na baka ginawin sila or lamigin. So what's a tendency? They wear different layers of clothes. So what are the causes of phobia? Direct experience. So sila mismo na-experience silang makagat ng aso, kaya pala may phobia sa aso. Experiencing a false alarm in a specific situation, biglang nagkagulo, yung pala false alarm. So yan na, meron ka ng fear. And then vicarious experience, nakita mo sa ibang tao. So napanood mo, o kaya nakita mo sa harap mo, nangyari, kaya what's a tendency, may phobia ka na. And then information transmission, laging balita, laging may news na mayroong airplane crash, kaya ayaw mo na tuloy sumakay sa airplane. So these are the different causes. What is the difference between specific phobia and PTSD? Ang phobia kasi basta wala yung feared object niya, okay yan. O kaya biglang na-trigger kasi nandiyan ang feared object, pero pag inalis mo, okay na siya. Ang PTSD hindi eh. Kahit alisin mo siya doon sa situation, napapanaginipan niya yan, meron siyang nightmares, merong avoidance, tapos most likely they can also develop depression, Tapos could resort to alcoholism and even substance abuse. So yun ang difference ng dalawa. Tapos ang PTSD kasi class, hindi siya pwedeng ma-develop ng via information transmission lang. No, yung tipong napapanood niya sa TV, hindi eh. Talagang meron siyang direct experience. No, involved siya doon. Separation anxiety disorder, usually in DSM-4 class, classified under the disorders usually first diagnosed in infancy, childhood, or adolescence. Kaya lang lifted and then placed under anxiety disorder kasi hindi lang siya pang bata. Even adults can experience separation anxiety disorder. So this is a fearful or anxious about separation from attachment figures to a degree that is developmentally inappropriate. Now, there is persistent fear or anxiety about harm coming to attachment figures and reluctance to go away from attachment figures, as well as nightmares and physical symptoms of distress. So lasting at least 4 weeks in children and adolescents and typically 6 months or more in adults. Ang mga adults usually ang na-experience niyan, no, yung sleeping in a hotel room, no, hindi sila comfortable, no, nightmares, moving in, or getting married. No, so usually pag kami ganito nandun pa rin kasama yung kanilang mga significant others, most especially parents, di ba? Specific dangers, this is one factor for the development of SAD, no? Kasi may accident na nangyari before, o kaya may kidnapping na nangyari before, mugging, may death or vague concerns about not being reunited with attachment figures. But we have to consider the culture, no? Let's say, for example, mga Asian countries, di ba? Kasi close family ties tayo, no? Nakatira sa isang bahay lahat, no? Yung anak ng anak natin, nandyan sa bahay, pati apo sa mga nandyan din. So, ang hirap din i-diagnose na kapag nahiwalay may separation anxiety disorder. No, in ang Western countries naman talagang based sa culture nila, they are encouraged to go out. No, pero siguro pagkaayaw, no, ito, pwede silang ma-diagnose with separation anxiety disorder. Pero we have to consider the factors. Gender, very common sa babae or sa lalaki. No, very common sa babae ang separation anxiety disorder. And what are the other factors? Pwedeng after stress, no, parental overprotection and intrusiveness. So ito yung mga other factors to consider for separation anxiety disorder. Diagnostic criteria, no, it's in your DSM-5. Sa mga bata, usually pag may separation anxiety disorder yan, hindi talaga sila umaalis sa tabi ng parents. No, kahit magsi-CR lang si mommy, kasama yan, aakyat sa taas, kasama pa din siya. What is the difference between separation anxiety disorder and school phobia? Ang bata, pag may school phobia, sa school lang siya ayaw magpaiwan. No, pero pwede mo yang iwan sa kapitbahay or even sa mall, maglalaro lang yan doon. Pero pag may separation anxiety disorder, sa lahat ng places ayaw niya magpaiwan. So that's the difference between the two. Social anxiety disorder, formerly known as social phobia. This is characterized by marked fear or anxiety about one or more social situations in which the individual is exposed to possible scrutiny by others. No, example nito is social interactions, having a conversation or meeting unfamiliar people, being observed, no, eating or drinking, and performing in front of others, or example, giving speech. So what are the factors of SAD? No, usually the person experiences stressful and humiliating experiences. And then, but we have to consider the culture. No, yung socially anxious may be considered appropriate in social situations. For them, it's a sign of respect. No, very common sa Japan yan. No, kaya hindi sila, they do not maintain contact. No, tapos yuyuko sila kasi it's a sign of respect. And then usually it lasts for 6 months or more. And social situations almost always provoke fear or anxiety. So blushing is a hallmark physical response of social anxiety disorder. Ito yung kanina nabanggit ko na culture. Sa Japan, yung Taijin Confucio, no, characterized by social evaluative concerns. Sa North America naman, ang concern nila yung olfactory reference syndrome. Yung baka meron silang body odor. No? And then shyness, hindi ito social anxiety disorder, it's a social reticence, it's a personality trait. No, pwedeng positive siya, no, kalimbawa nahihiya kang kumopya ng assignment, no, it's a social reticence yan, personality trait siya. No, pag sinabi kasi social anxiety disorder, you fear, comments from people. No, you do not want to perform in front of a large audience because you already experience a traumatic or you receive not so good feedback. No, so ayaw mo ma-humiliate. So diagnostic criteria for social anxiety disorder, ano naman to same yung na-discuss natin sa features niya. But kindly consider that an individual who is afraid to speak in public would not receive a diagnosis of social anxiety disorder if this activity is not routinely encountered on the job or in classroom work and if the individual is not significantly distressed about it. No, kung halimbawa, usually ang mga architects, engineers, madalas kasi nagdo-drawing talaga sila. So if they're not comfortable to speak in public, they would definitely not receive a diagnosis of social anxiety disorder kasi hindi talaga nila yung trabaho. Most likely siguro pag psych o kaya com, no, pagka medyo hindi comfortable, yan, baka possible. Selective mutism. Now, this is characterized by a consistent failure to speak in social situations in which there is an expectation to speak even though the individual speaks in other situations. No, pagka selective mutism, nagsasalita pero selective. Pero pag nagsalita naman siya, konting words lang. No, it can be yes or no o kaya nagge-gesture lang siya. No, they do not initiate speech or reciprocally respond when spoken to by others. Onset is usually before age 5. So at least 1 month, no, but not limited to the first month of school. So kung halimbawang new student ito, during the first month, syempre, hindi mo muna yan i-consider na may selective mutism kasi nag-a-adjust pa siya. No, the failure to speak is not attributable to a lack of knowledge. No, hindi naman sa kaya pala hindi siya nagsasalita kasi hindi niya alam, no? So hindi yan selective mutism. And then of course the disturbance is not better explained by a communication disorder, no, and does not occur exclusively during the course of autism spectrum disorder, no, schizophrenia or another psychotic disorder. Kung merong problema yan, nag-stutter siya, no, hindi yan selective mutism. It's may speech problem siya, that's one. And then very common din kasi ang selective mutism sa may autism, no, schizophrenia or another psychotic disorder. Diagnostic criteria, no, kindly check in your DSM-5. And then what are the factors? It can be parental modeling, overprotective or controlling. No, so si parent na lagi ang sumasagot, kinakausap siya ng kapitbahay, no, so si mommy ang sumasagot, so hindi maganda, that's also one factor. Or pwede din kasing parental modeling sa bahay, hindi rin masyadong nagsasalita ang parents. So, naggagaya ng bata yon. And then pwedeng culture, no, kapag immigrated to a country, most likely din kapag they transfer from one country to another ng madalas because of businesses, it can be one factor for selective mutism. Siyempre, pag bago siya sa place, hindi niya alam yung language, hindi talaga siya makakapagsalita. Ito yung anxiety disorder due to another medical condition. Diagnosed when the medical condition is known to induce anxiety and when the medical condition preceded the onset of the anxiety. So may anxiety siya, pero it's because of another medical condition. So this is one. Ito yung other specified anxiety disorder. Other specified anxiety disorder, this category applies to presentations in which symptoms, characteristics of an anxiety disorder that causes clinically significant distress or impairment in social, occupational, or other important areas of functioning predominate but do not meet the full criteria for any of the disorders in the anxiety disorder diagnostic class. No? So mayroong GAD, pero not occurring more days or not kasi hindi na-meet pa yung full criteria. No? Pwedeng merong iba-ibang criteria pero not the full. Itong unspecified anxiety disorder, no, symptoms characteristic of an anxiety disorder that cause clinically significant distress or impairment in social, occupational, or other important areas of functioning predominate but do not meet the full criteria for any of the disorders in the anxiety disorders diagnostic class. No, it also affects their day-to-day functioning pero hindi ma-specify kung alin doon kasi pwedeng present lahat ng signs and symptoms ng lahat ng disorder pero so hindi natin ma-specify kung alin ba sa anxiety disorder. So pagka ganyan, ito ang diagnosis niya, unspecified anxiety disorder. So ito, you might want to, for your review, you might want to make a table no, para hindi kayo mahirapan. No, you can make a table na, let's say, it's a general description, tapos you look for the main feature, no, para madali siyang ma-distinguish. Yan. Any questions? Siguro, kindly get a scratch paper or any paper or your notebook. Tingnan natin, this is only 40 items. So you challenge yourselves. O sige. Ready na? Meron kayong paper, pen? Okay, shall we start? Sige. Number 1, which of the following examples is most clearly abnormal according to the disability, dysfunction, impairment definition of abnormality? Letter A, a mean, callous supervisor who remains unaware that his or her employees hate him or her. Letter B, a librarian whose religious hallucinations interfere with her ability to work. Letter C, a child whose IQ is below the cutoff point for mental retardation. Letter D, a high-functioning accountant who feels depressed about several aspects of his or her life. Siguro, let's answer first, tapos babalikan natin for the correct answer. Ay, sorry. So, finish na ba? Sige, let's proceed to number 2. Portia is a 33-year-old married woman working as an accountant at a large firm. So 8 months ago, her father, with whom she was close, died unexpectedly. And a month ago, her firm announced that they would be laying off 40% of its accountancy staff within the next 3 months. At present, Portia is experiencing moderate depressive and anxious symptoms, and these symptoms appear to be taking a toll on both the quality of her work and the quality of her relationship with her husband. So in the present case, which factor would be considered an etiological factor for her depression and anxiety? Letter A, the downturn in the quality of her marital relationship. Letter B, the downturn in her work quality. Letter C, her father's death. Letter D, more than one of the above. Finish. Okay, number 3. A therapist regularly visits the homes and workplaces of his or her clients in an attempt to actively understand the client's daily stresses. It is most likely that this therapist is a, letter A, clinical social worker, letter B, clinical psychologist, letter C, counseling psychologist, letter D, psychiatric nurse. Okay, next, number 4. In the mid-1880s, if you had trouble remembering things, occasionally lost use of your arms or legs, and did not respond to pain properly, Charcot would likely have diagnosed you with blank and treated you with blank. Letter A, insanity, poetry readings. Letter B, insanity, hypnosis. Letter C, hysteria, poetry readings. Letter D, hysteria, hypnosis. Okay, number 5. Dr. Siegfried believes that abnormal behavior ranging from mood disorders to eating disorders to sleep disorders is due to structural, functional, or chemical abnormalities in the central nervous system. We would say that he adheres to the blank model of psychopathology. Letter A, developmental. Letter B, cognitive. Letter C, biological. Letter D, learning. Excuse me. Okay, number 6. In order to be useful, assessment techniques should be based on A, beliefs, letter B, attitudes, letter C, evidence, D, assumption. Number 7, during an interview, the interviewer says, I'm not sure what you mean, but you say your friend really let him have it. Can you explain? Now, this is an example of blank interview question. A, clarifying, B, facilitative, letter C, open-ended, D, confronting. Okay, number 8. The systematic development of a scientific approach to psychopathology is represented by A, humanistic psychology, letter B, psychoanalysis, letter C, Jungian psychology, letter D, behavioral model. Finish na. Okay, number 9. What kind of psychologist would be most likely to describe depression as the result of an unconscious process in which anger is turned inward? A, biomedical, B, cognitive, C, psychoanalytic, D, behavioral. Okay, number 10. Current evidence suggests that genetic factors may play an important role in which of the following disorders? A, schizophrenia, B, Alzheimer's disease, C, bipolar disorder, D, all of the above. Number 11. Extremely low activity levels of serotonin are associated with A, aggression, suicide, and impulsive behavior. B, schizophrenia. C, anxiety disorders and general feelings of nervousness. D, mania. Okay, number 12, your uncle spent most of his teen years in a hospital undergoing treatment for a severe physical illness. As an adult, he is rather shy and withdrawn, particularly around women. He has been diagnosed with social phobia, and you believe that it is entirely due to lack of socialization during his teen years. Your theory or model of what causes phobia is letter A, multidimensional, B, integrative, C, one-dimensional, D, biological. Okay, number 13. Depression and schizophrenia seem to appear in all cultures but tend to be characterized by different symptoms within individual cultures. For example, depression in Western culture is generally characterized by feelings of guilt and inadequacy, where in developing countries, it is characterized by physical distress such as fatigue or illness. This is most likely due to letter A, genetic differences between individuals living in different cultures. Letter B, differences in treatment provided in different cultures. Letter C, reasons that our current methods of study are incapable of understanding. Letter D, the fact that social and cultural factors influence psychopathology. Okay, 14. Mental health professionals holding the socio-cultural perspective view mental disorders to be the result of A, how people interpret their behavior as normal or abnormal. Letter B, malfunctioning of the brain and nervous system. Letter C, learned maladaptive behavior patterns. Letter D, intrapsychic conflict. Number 15, what defense mechanism may be more commonly considered fully compatible with mental health? A, projection. B, sublimation. C, displacement. D, reaction formation. We go to the next. 16, when asked what to do if he's hungry, the patient stated that he will cry and throw temper tantrums. This indicates that the patient has A, good insight, B, poor insight, C, good judgment, D, poor judgment. Okay, we move on. Number 17, depression and anxiety often share a common genetically determined biological vulnerability. Hence, prevalence will be higher among A, dizygotic twins, B, monozygotic twins, C, siblings, letter D, relatives. Now, we move on to number 18. A phenotype is defined as an individual's A, hidden characteristics, B, observable characteristics, C, genetic influences, D, unique genetic makeup. Number 19, as part of a psychological assessment, a mental status exam is used to find out how a person thinks, feels, behaves. Its primary purpose, however, is to determine A, if a psychological disorder might be present, B, what type of treatment should be used, C, which medication would be most effective, and letter D, whether the individual also has a medical condition. Number 20, the fact that depression can be caused by mental illness or drug use is an example of how A, once a process has begun, it will always lead to a final outcome. B, many causes of psychopathology are equal in influence. Letter C, a number of paths can lead to the same outcome. Letter D, all forms of psychopathology have similar causes. Okay, number 21, a lifespan psychologist would point out that the only way to understand a patient's disorder is to understand how the individual, A, developed from childhood to adulthood, B, developed during the psychosexual stages, C, resolve conflicts in early life, letter D, sees himself or herself as part of a family, community, and a culture. Number 22, the causes of psychopathology are currently assumed to be A, unidimensional, B, multiply determined, letter C, impossible to determine, letter D, untestable scientifically. '23, the likely future course of a disorder is called its A, prognosis, B, etiology, C, diagnosis, D, inference. Okay, we move on to 24. In a clinical interview, the law regarding privileged communication does not apply if the patient A, threatens self-harm or harm to another person, B, relates a history of sexual abuse, C, has been mentally ill for more than 5 years, D, is hospitalized in a psychiatric facility. We move on to 25. A 37-year-old man comes to the physician with the chief complaint of new onset visual hallucinations for 1 month. He states that he sees flashing lights and movement when he knows that there is no one in the room with him. He also complains of a headache that occurs several times per week and is dull and achy in nature. A brain tumor is found on MRI. So in which of the following areas of the brain is this tumor most likely found? A, frontal lobe, B, parietal lobe, C, occipital lobe, D, temporal lobe. We move on to 26. The psychoanalytic perspective would most likely view phobias as A, conditioned fears, B, displaced responses to incompletely repressed impulses, C, biological predispositions, D, manifestations of self-defeating thoughts. We move on to 27. A 28-year-old patient represents with symptoms of chronic anxiety. Now, these include worrying about a host of problems that are not specific to any one category. Her physical symptoms include muscle tension, insomnia, and restlessness. Her anxiety is interfering with her ability to work and she is unable to control it. Letter A is phobia, letter B, social phobia, C, generalized anxiety disorder, and D, panic disorder. So we move on, 28. A 12-year-old boy comes to the CAM infirmary with a primary complaint of anxiety symptoms, including worry, feeling frightened, short of breath, tearful and worried that he's going to die. So these symptoms seem to be related to beginning camp and are interfering with his ability to participate fully in the camp's activities. On physical examination by the camp physician, she hears wheezing when oscillating his lungs. She then checks his tidal volume and finds it significantly reduced. She chooses to give him an asthma inhaler and checks his tidal volume several minutes later when he feels much better and it is normal. So which of the following diagnoses does most likely he have? A, anxiety disorder. B, unspecified anxiety disorder. C, anxiety disorder due to another medical condition. Letter D, selective mutism. Okay, we move on to 29. The flow of a 10-year-old boy's speech is interrupted by hesitations, repetitions of syllables, and excessive sound prolongations. These symptoms worsen when the boy is asked to speak in front of the class. Which of the following statements about this disorder is correct? Letter A, it typically worsens with anxiety. Letter B, treatment predominantly involves the use of medication. C, it is commonly associated with selective mutism. Letter D, family members are rarely affected. We move on to number 30. A 10-year-old boy, late latency, early adolescent boy exhibits extremely anxiety when not in the presence of his mother. So as a result, he no longer attends school but seems quite bright and cognitively on target. His anxiety symptoms began after the mother experienced a serious life-threatening illness. The patient believes that if he is separated from her, something terrible might happen to her. So in addition, he reports several somatic complaints that have been difficult to diagnose. Which of the following is the correct diagnosis? A, social anxiety disorder. B, social phobia. C, separation anxiety disorder. And D, selective mutism. So we move on to 31. Every semester, just before midterm exams, Lily gets very anxious and worries about how she is going to do. To reduce her apprehensions, she studies very hard. Lily suffers from A, anxiety disorder, B, free-floating disorder, C, panic disorder, letter D, none of these disorders. Her symptoms are quite normal. We move on to 32. Perry has dropped out of college because of the extreme distress that being in social situations causes him. He is unemployed because he is unable to bring himself to go for a job interview. Perry is suffering from A, God, B, social phobia, C, social anxiety disorder, D, both C and D. I'm sorry, ang letter D, that's both B and C. So A, God, B, social phobia, C, social anxiety disorder, D, both B and C. We move on to 33. According to DSM-5-TR criteria, the symptoms of panic attack develop abruptly and reach a peak within A, minutes, B, hours, C, seconds, and D, days. We move on to 34. A first grade teacher is concerned about a 6-year-old girl in her class who has not spoken a single word since school started. The little girl participates appropriately in the class activities and uses gestures and drawings and nods and shakes her head to communicate. The parents report that the little girl talks only in the home and only in the presence of her parents and siblings. Which of the following is the most appropriate diagnosis? A, autism, B, school phobia, C, panic disorder, and D, selective mutism. So we move on to 35. Which of the following is not a basic type of panic attack? A, expected, B, unexpected, C, both A and B, letter D, situation, inevitable. Okay, we move on to 36. All of the following are characteristics common to specific phobias except A, strong and persistent anxiety related to a specific object or situation. B, significant attempts by the anxious individual to avoid the phobic situation. C, recognition by the person with the phobia that the anxiety is excessive or unreasonable. And D, decreased arousal of the autonomic nervous system. We move on to 37. Anxiety is closely related to which of the following psychological disorders? A, schizophrenia, B, dementia, C, depression, D, psychosis. Number 38. 25-year-old Daisuke suffers from a disorder similar to social phobia called Taijin Kofusho. In addition to suffering extreme social anxiety and the need to avoid social situations, Daisuke is likely A, to have a preoccupation with imagined diseases based on his misinterpretation of bodily symptoms or function. Letter B, to be very concerned with being embarrassed in public. Letter C, to worry about being overcome with an irresistible urge to set fire to people and things. Letter D, to fear that his appearance or smell, facial expressions, or body language will offend, insult, or embarrass others. We move on to 39. Which of the following statements best describes the cognitive approach to the treatment of panic disorder? Letter A, taking the patient to a crowded place and preventing escape until the patient's anxiety has peaked. Letter B, teaching the patient to hyperventilate as soon as he or she starts feeling anxious. Letter C, educating the patient about the harmless nature of the physical symptoms experienced during a panic attack. Letter D, replying empathically to the patient about the suffering that must be endured with panic attacks. And last item, number 40, all statements are true about separation anxiety disorder except A, it is often associated with school absenteeism. Letter B, it is often caused by parental overprotection and intrusiveness. Letter C, there is persistent fear or anxiety. Letter D, it is exclusive for children below 12 years old. Sige. So let's see your answers. Dapat perfect, ha? Teka lang. Sige. Number 1 question, the correct answer is letter C. Letter B. No, a librarian whose religious hallucinations interfere with her ability to work. No, kasi na-affected na yung kanyang output. Na-affected na yung kanyang day-to-day functioning. Yung letter A kasi a mean callous supervisor who remains unaware that his or her employees hate him or her. No, hindi naman ito, dinidescribe lang naman siya. No, so walang binanggit about yung kanyang output o kaya yung kanyang relationship with other, walang binanggit namin nakakaaway na siya. No, unaware lang naman siya. Tapos yung letter C, a child whose IQ is below the cut-off point for mental retardation, dinescribe lang din naman yung IQ level niya. So hindi rin siya papasok kasi din ito sa kalis sa sa norms. And letter D, a high-functioning accountant who feels depressed about several aspects of his or her life. Depressed siya pero high-functioning pa din. So hindi siya pasok dito sa criteria na disability, dysfunction, or impairment. So letter B is the correct answer. Number 2, the correct answer is ang correct answer dito is letter C, her father's death. No, bakit father's death? Bakit hindi more than one of the above? Kasi wala namang binanggit dito na na-stress siya about the layoff. No, so ang nabanggit dito ay yung father's death. Tapos at present, Portia is experiencing moderate depressive and anxious symptoms, and these symptoms appear to be taking a toll on both the quality of her work and quality of her relationship with her husband. So, ano ba ang ano dito, ang pinaka main cause, no, sabi dito, which factor would be considered as the etiological factor for her depression and anxiety? It's the father's death na nag-affect yung kanyang relationship, no, sa work at saka sa kanyang marriage, sa husband niya. Number 3, so ang keyword dito visits homes and workplaces, office clients. So it's letter A, no, clinical social worker. Number 4, so Charcot would likely have diagnosed you with a letter dog is the correct answer. Hysteria, tapos treated you with hypnosis. No, kasi si Charcot yan yung kanyang favorite din, hypnosis, along with mesmer. Letter D, number 5, the correct answer is letter C, biological. No, due to structural functioning or chemical abnormalities in the central nervous system. Number 6, in order to be useful, assessment technique should be based on letter C, evidence. Number 7, I'm not sure what you mean, no, when you say your friend really let him have it. Can you explain? So this is letter A, clarifying. Number 8, scientific approach to psychopathology. It's letter dog, behavioral. No, di ba sabi ni Watson, if we want psychology to be science, we should study what is observable. Number 9, what kind of psychologist would be most likely to describe depression as the result of unconscious process? So ito yung keyword, unconscious process in which anger is turned inward. Letter C is the correct answer, psychoanalytic. Number 10, current evidence suggests that genetic factors may play an important role in which of the following disorders? The correct answer is letter dog, all of the above. 11, extremely low activity levels of serotonin. The correct answer is letter A, aggression, suicide, and impulsive behavior. 12, so ito, ang tiningnan dito entirely due to lack of socialization during his teen years. So isa lang ang tiningnan. So ibig sabihin one-dimensional. Now it's letter C. 13. The correct answer dito is letter dog. No, the fact that social and cultural factors influence psychopathology. Hindi pwede itong treatment kasi wala namang binanggit na treatment. So, dinescribe lang kung paano nila nakikita ang depression and schizophrenia. Number 14, mental health professionals holding sociocultural. So, the correct answer is letter A, no, how people interpret their behavior as normal or abnormal. Yung letter B, this is biological. Letter C, this is behavioral. Yung itong intrapsychic, psychoanalysis yan. Kay Sigmund Freud. Commonly considered fully compatible with mental health, it's letter boy, sublimation. Kasi you learn how to be flexible and adapt to the needs of other people. Number 16. When asked what to do if he's hungry, the patient stated he would cry and throw temper tantrums. This is letter dog, poor judgment. Ang insight, pag sinabing insight, naintindihan ng patient kung bakit siya for treatment. So yung judgment, ano to? Mga you give hypothetical questions. 17, so depression and anxiety often share a common genetically determined biological vulnerability. So ang prevalence niya would be higher among, syempre lahat higher dito, pero mas ano siya, mas affected ang, which one? Dizygotic o monozygotic? Letter B, di ba? Monozygotic. Ito yung identical twins Yung di kasi dalawa yan, nag-separate siya sa egg ng mother. Pero ang mono, they share the same egg. So mas mas mataas ang vulnerability ng mono kaysa sa di, kaysa sa siblings at saka sa relatives. 18, a phenotype is defined as an individual's. When we say phenotype, this refers to observable characteristics. Letter B is the correct answer. Pag sinabing genotype, letter D yan, unique genetic makeup. No, let's say for example, ang Down syndrome, ano ang kanyang genotype? 'Di ba meron siyang problema sa chromosome number 23. Yan ang unique genetic makeup niya. Ano ang phenotype ng may Down syndrome? Observable characteristics, 'di ba? Stunted growth, short neck, no? Yan yung tinatawag nating phenotype. No, pag sinabing unique genetic makeup, genotype, yan. So pag narinig nyo na yung phenotype, yun yung ano naman, has something to do with the observable characteristics. As part of psychological assessment of an MSE, the primary purpose of MSE is letter A, if a psych disorder might be present. Number 20, the fact that depression can be caused by mental illness or drug use is an example of letter C, a number of paths can lead to the same outcome. This refers to the equifinality. So ang depression pwedeng caused by siya ng mental illness or pwede ring drug use or pwedeng environmental din or pwedeng genetic. So letter C, no, number of paths can lead to the same outcome. 21, a lifespan psychologist. So this is your keyword, lifespan psychologist. Ibig sabihin, the correct answer is letter A, no? Develop from childhood to adulthood. Number 22, of course, letter B, no, multiply determined. 23, the likely future course, the correct answer is letter A, prognosis. Pagka na-diagnose mo na, meron ka na talagang psych disorder na binigay, that's letter C, diagnosis. Pag sinabing etiology, yung causes niya. Pag sinabing inference, ito yung based sa research mo o kaya sa experimental research mo, meron kang inference, no? Kumbaga ito yung parang conclusion mo, yung result. 24, not applicable ang privileged communication sa letter A, no, if it threatens self-harm or harm to another person. When we say privileged communication, yung mga sinasabi sa'yo must be kept secret o kaya confidential talaga yan. But pwedeng ma-break ito kapag ka letter A. 25, so meron siyang visual hallucinations. Tapos based sa MRI result, meron siyang brain tumor. So most likely ang brain tumor ay nasaan situated sa letter C, occipital. 'Di ba nasa occipital natin yung eye function, yung visual. 26, the psychoanalytic perspective, no, most likely view for B, no, displays responses to incompletely. 27, meron siyang muscle tension, insomnia and restlessness, tapos worry about a host of problems that are not specific to any one category. So the correct answer is letter C. 28, the correct answer dito is letter C, anxiety disorder due to another medical condition or pwede anxiety disorder due to asthma. No, depende sa choices. So pwedeng specific din ang ilagay dyan. Kasi meron siyang anxiety symptoms pero nakitaan na meron siyang interrupted by hesitations, repetition of syllables, and excessive sound prolongation. Tapos it worsens, no, when the boy is asked to speak in front of the class. So the correct answer is letter A. It typically worsens with anxiety. So hindi ito selective mutism. Nagkakaroon nga siya ng problema sa speech, pero meron pa siyang isang criteria dito. The symptoms worsen when the boy is asked to speak in front of the class. So most likely that is social phobia or social anxiety. 30, exhibits extreme anxiety when not in the presence of his mother. So nag-start yung anxiety niya when the mother experienced serious life-threatening illness. So this is letter C, separation anxiety disorder. 31, what's your answer here? So 31, the correct answer is letter dog. No, none of these disorders or symptoms are quite normal. No, kasi ang anxiety, experiences of anxiety class is also considered as a shadow of intelligence. No, kapag ka merong feelings of anxiety, in some way we would know what to do, no? Takot tayong bumagsak kaya tayo nag-aaral, no? Takot tayong mapahiya sa performance kaya tayo nagpa-practice. So dito, anxious sa kanyang midterm exam, kaya anong ginawa niya? She studies very hard. So walang disorder yan. 32, distress that being in social situations causes him. So this is letter dog, no? Both B and C. No, social phobia is also known as social anxiety disorder. 33, the correct answer is letter A, minutes. Kasi sa DSM-4, 10 minutes yan. Dito minutes na lang siya. 34, a first grade teacher is concerned about a 6-year-old girl in her gestures. No? She nods and shakes her head to communicate. So the correct answer is letter dog, selective mutism. 35, the correct answer is letter dog, situation inevitable. Itong situation inevitable, nasa DSM-4 yan. Pag sinabing situation inevitable, case to case siya. Minsan nagpapanik, minsan hindi. No? So, pero tinanggal na siya. So, dalawa na lang. It's expected or unexpected. 36, except, letter dog, decrease eh. So, dapat increase yan kapag ka mayroong specific phobia. 37, comorbid or co-occur with letter C, depression. 38, so Taijian confusion is letter dog. No? Fear that his appearance or smell, facial expressions, or body language will offend, insult, or embarrass others. 39, best describes cognitive approach to the treatment of panic disorder. The correct answer is letter C, educating the patient about the harmless nature of the physical symptoms experienced during a panic attack. Ito kasing letter A na taking the patient to a crowded place, behavioral siya. Diba? Tapos teaching the patient to hyperventilate, in some way behavioral din siya, tapos breathing exercise siya. Itong letter D, replying empathically to the patient, ano lang, this is your response as a therapist. No? Pero pagka-cognitive, pinapaintindi mo sa kanya yung harmless nature of the physical symptoms experienced during panic attack. Number 40, the last one, the correct answer is letter dog, except. No, except it's no longer exclusive for children below 12 years old kasi even adults can experience separation anxiety disorder or can be diagnosed with SAD. Ayan. So, anong scores ninyo? Ang taas naman, 36. Okay lang, don't worry. Don't feel bad kung mababa ang scores. No, kasi yung mga mali nyo for now, most likely yan ang matatandaan ninyo sa board exam. So, basta keep on challenging yourselves. And so, any questions? So I think we will meet next time. So we'll continue. No, we'll review the other disorders pa. Then I'll provide practice test ulit. Sige, so I think you can have your lunch now, Sir Barcarce. Thank you din. Thank you sa inyo.